Good morning. I'm Andrew Natsios, the director of the Scowcroft Institute of International Affairs at the Bush School of Government and Public Service at Texas A&M University. Welcome to our 6th annual Pandemic Policy Summit. Although this year looks very different than it did last year at the same time, we changed our plans for this summit several times because of events. But we're happy to bring all of these together under the umbrella of the bioeconomy. Your video will be turned off and your microphone will be muted during the panel discussion. If you have a question for the panelists, please use the Zoom chat feature to message to Lauren Zajacek. When you message her, please let her know your first and last name, your organization, and your position with that organization. She will cue you and ask you to unmute and turn on your video when it is your turn to ask questions. Our discussion today will cover an overview of the bioeconomy and technologies that could benefit and pose challenges to this economy. Tomorrow we will cover the legal aspects of the bioeconomy as well as discuss the reasons we are here today online, which is, of course, COVID-19. I might add that we are in the middle of one of the great technological events of the bioeconomy since World War II, and that is the extraordinarily successful production of a vaccine in a short period of time. But first, we're happy to present our keynote speaker, Ms. Rosemary Gibson. Rosemary is the author of China RX, Exposing the Risks of America's Dependence on China for Medicine, which reveals the dramatic shift in where medicines are made and growing concerns about their quality. It highlights the centralization of the global supply of medicines in a single country and the implications in the event of a global pandemic, a natural disaster, or a geopolitical event. Ms. Gibson testified before the House Energy and Commerce Health Subcommittee in October of 2019, before the pandemic started, at least publicly, and to the U.S.-China Economic and Security Review Commission in July of 2019. She has briefed senior leaders in the executive branch, Congress, and industry leaders on the national security threats from U.S. dependence on China for medicines and has proposed solutions to mitigate the risk. Earlier in her career at the Robert Wood Johnson Foundation, Ms. Gibson was the architect of its decade-long national strategy to bring palliative care into the nation's hospitals. When the work began, a handful of hospitals had a palliative care program, whereas today 2,000 acute care hospitals have this program. She worked with Bill Moyers on the PBS documentary On Our Own Terms. She is a recipient of the Lifetime Achievement Award of the American Academy of Hospice and Palliative Medicine. While at the Johnson Foundation, Ms. Gibson led national quality improvement and patient safety initiatives in partnership with the Institute for Healthcare Improvement. She is an senior advisor at the Hastings Center, and she is a recipient of the American Medical Writers Association Award for outstanding contributions to the public interest in reporting on critical healthcare issues. We thank you for fighting the Zoom fatigue today to join us in this important discussion. I now turn this over to Ms. Rosemary Gibson. Thank you for being with us this morning.
Well, thank you very much, Andrew, for the opportunity to be here. Can you hear me okay?
Yes.
Wonderful, thank you. Good morning and welcome, everyone. It's a pleasure to be with you today to talk about a subject that affects everyone here, our families, here and around the world. As Andrew kindly mentioned, the topic is our dependence on China for medicines. What are the risks and what are the solutions? I spent 3 years researching a topic that I knew nothing about. I stumbled on this subject matter, and it resulted in a book called China RX. And it's extraordinary. It came out in 2018 in April, and it actually predicted that in the event of a natural disaster or global pandemic, the United States will be waiting in line with other countries for essential drugs. One of the things we learned from COVID is this is exactly what's happened. The second prediction in China RX is that the FDA, which regulates the manufacturing of generic drugs, and let me say at the outset, the focus of this discussion from my side is on the generic drugs, which are 90% of the medicines that we take. If you walk into any hospital in the country, intensive care unit, emergency room, you'll probably be getting a generic drug. This is not about the branded products. It's not about vaccines. This is about the bread and butter products that make our healthcare systems function in the best of times, and which we surely need in the context of a pandemic. So China RX actually predicted that the FDA's ability to protect the public would be greatly diminished. And in fact, we have seen that. Earlier this year in February, the FDA announced that it was recalling all of its inspectors. These are people that actually go into manufacturing plants, and this is the heart of its regulatory process. It's the gold standard to assure that products are made safely. This is not just about the approval process for new drugs. This is assuring that they are produced according to very strict specifications. And so since February, with the FDA not conducting inspections in China and elsewhere, we are effectively, as I say publicly, importing unregulated products. And I think in the case of China, it's going to be increasingly difficult for the FDA to have any presence there in the future for a variety of reasons. So what did we learn from COVID? I testified earlier this year to the Senate committee right before the shutdown, and I shared with them that we're facing this pandemic, but the essential generic drugs that we need to care for people hospitalized with coronavirus, the starting materials, the core chemicals to make them, 90% of the global supply of those chemicals are sourced from China. For propofol, for oppressor agents, antibiotics, we'll talk more about that in a minute, basic anti-inflammatories, bronchodilators. These are the things you need to care for people with coronavirus, and also for very sick patients in the ICU in a non-pandemic situation. And we can't make them. We can, but we just aren't. I'd like to cover 4 points of it today. How dependent are we? How did we get here? What are the risks, which by now I think you can see are quite obvious? And solutions. And I've migrated to the only solution I think that makes sense, which is domestic manufacturing of some capacity for basic essential drugs. And it's been fascinating to hear that there are some who are actually proposing, well, let's just have stockpiles, that we don't need to do domestic manufacturing, let's just stockpile. Think about that for a minute. And this was from a senior government official who heard this recommendation from industry. That's like stockpiling food that we don't need to grow it, that we don't need farmers. What do you do when the stockpile runs out in the middle of a pandemic? So stockpiling is not a solution. It's an interim step. And by the way, it's hard to stockpile everything for a country of 350 million people, every possible drug that you need, or even just the essential ones. The second solution is nearshoring. Maybe Canada or Europe. Well, what we learned during a pandemic is that more than 70 countries banned exports of essential drugs because they needed them for their own people. One of the reasons there was a shortage of propofol is that Italy makes the finished product, and they banned exports because they needed them for their own people. So nearshoring is not a solution. There has to be some basic level of domestic manufacturing of these bread and butter products necessary for life and really for a country's survival. So how dependent are we? This is an emergency preparedness report from the late 1980s, prepared under the auspices of Oak Ridge National Laboratory. It's about antibiotic production. We're talking about biosecurity today in this conference. Back then, we knew where every single antibiotic manufacturing plant was located. We had the contact information, we knew what they were making, how much they were making.
Rosemary, you're not
Yes.
showing your slides.
Oh, the slides are not coming up?
No, ma'am.
Oh my goodness. Oh, that's the best part. Thank you, Lauren, for letting me know. Oh, this is the best part. My sincere apology. How's that, Lauren? Hello?
Perfect. Thank you.
Okay, great. Oh, my apologies. So yeah, this is China RX. The fact that we can't make 90% of our basic essential generics to treat COVID patients are 4 points. And how dependent are we? So this is an emergency preparedness report that was done in the late 80s, and where we made every antibiotic in the country, who was making it and what they were making: tetracyclines, cephalosporins, penicillins. Now, we can't make any of it, or we're not making any of it. We are not making any of the most basic antibiotics to treat ear infections in children, the medicines you take for bronchitis as winter approaches, pneumonia, sepsis, STDs, even anthrax exposure. It's really quite remarkable that we allowed our industrial base to manufacture basic antibiotics to leave the country. And it's just surprising to me that we find vaccines are very important, but no one's talking about resuscitating antibiotic manufacturing here in the United States. When, after 9/11 and the anthrax attacks, we had to get the starting material for the antibiotic doxycycline from a plant in China, and a European company made the finished drug. How dependent are we? This is a quote from the CEO of a privately owned generic drug company in Europe. And the Europeans were much more transparent while I was writing China RX. He said, if China stopped exporting the ingredients, the core components to the United States within months, initially he said 3 months, all the pharmacies would be pretty empty. And as mentioned, more than 70 countries banned exports of essential drugs and supplies during a pandemic, and that's understandable. And all this was predictable. You know, we predict hurricanes and we prepare for them. What we saw with COVID was absolutely predictable, but no one prepared. And this goes back, 15, 20 years, back into the 90s. So we could have fixed it, but I hope going forward we can make a better effort. China's stated aim is to become the pharmacy to the world. And it's actually getting into civilian and military healthcare systems and products. What was a turning point for me is that this is not just the marketplace, as you'll see. This is about something far greater than that. It's not just because China's cheaper, its labor costs are lower regulatory costs. What changed my mind on this was attending a hearing at the US-China Economic and Security Review Commission. And this gentleman testified about the strategy that's underway in all of the 20 advanced industries that are the future of our economy. It's all of its legal and illegal tactics to undermine and undercut Western industries, telecommunications, including pharmaceuticals. So we have to ask ourselves, where are we going to be in 5 years? And this is just from a report that this gentleman did about the infiltration. So how did we get here? China RX documents for the first time the cartels that China has formed in our medicine supply, notably what I call the penicillin cartel. We can no longer make penicillin. And here's why. This is data from an industry group in Europe that was very generous. They shared their data on what happened in the market from the late 80s to mid 2000s. The bar graphs are total global domestic production of penicillin material. The sub bars are China's growing share. It did a very smart thing, very strategic, good for them and their 1.3 billion people. The government invested heavily in infrastructure for antibiotic production. And the New York Times reported in 2004 that the last penicillin plant in the United States was closing. This was Bristol Myers Squibb up in New York in 2004. And look at this data. It was remarkable to show the correlation. The yellow line is price. Look what happened to price from the late 80s. Prices were coming down. But then in 2004, you see that steep drop, and then it stays low for about 4 years. That is when industry people say that China dumped product on the global market and drove out US and even Indian producers. Even India, with its more than 1 billion population, has no capacity to make penicillin and other antibiotics. It's really quite remarkable. So the centralization of the global supply of critical components to make antibiotics that are necessary for survival, even in the best of times, is very, very concerning. This is the industrial capacity that we lost. This is the Bristol Myers Squibb plant. 50 buildings were demolished. The workforce gone. This is what we lose. And if the private sector can't do this alone, there needs to be a partnership with government. And I also, it's my personal view that this is not a place where I see these products more as public utility, public good type products. We can talk more about that later. China's dominance is global. It's not just the United States. This is a very courageous and forthright documentary done by Dutch public television. And they interviewed a gentleman who worked in the pharmaceutical industry for many years, who's now retired. And this was pre-COVID. And he said, now we're afraid that China will do things to deprive us of our medication. This is someone from Europe, and there's no trade kerfuffle between the Netherlands and China. There's a recognition of the enormous leverage that a country has over others in the world if you control the supply, not just of antibiotics. The story of antibiotics is true for thousands and thousands of basic generic drugs. The same gentleman from the industry said, people said, well, Rosemary, where's your proof that China controls the raw materials? I mean, people in the industry know this. And we found out during COVID that India depends on China for more than 70% of the core starting materials for its huge generic industry. And here this gentleman in the industry has worked 35 plus years, said, you can say that China owns the raw materials market worldwide. And this is true even for the innovator products like remdesivir. It's not just for generics. So how can we produce things in the future without domestic capacity? This is a very important slide that depicts where the chokehold is. At the bottom are finished drugs, the pills we take. In the middle are what's called API. I've been very impressed that because of China RX, the word API is out there. That means active pharmaceutical ingredient, which is what makes a medicine medicine. At the top of the triangle are the key starting materials called KSMs. That's where China has the global chokehold. And by the way, the FDA does not regulate those key starting materials. It doesn't go in and inspect antibiotic fermentation plants. So who knows what's going on there? And so the FDA doesn't count them. So you have to be very careful when the FDA comes out with data on dependence of the US on China, because it just doesn't have the data at this tip of the triangle. China's rapidly moving up the value chain or down the triangle. About at least 10% of our generic drugs are being made there, and that's a market share that China achieved in just 10 years. Here's some examples of their products being sold here. Doxycycline, from Lyme disease to anthrax exposure. Again, we can't make it here. Chemotherapy products for cancer treatment. Antidepressants, birth control pills, Alzheimer's, HIV/AIDS, metformin, blood pressure medicines, and so much more. And now we're seeing, this is a company, a Chinese company, a very large one. China does, it's a very smart strategy, invest in a few large firms that will have global dominance. And this one particular company bought a shuttered manufacturing facility in North Carolina. What's very concerning about this is the same company whose plant in China sold to the United States and the world, more than 20 countries, an active ingredient for a blood pressure medicine called valsartan. That blood pressure medicine was subject to a global recall in July of 2018 because of toxic levels of a carcinogen called NDMA. There are multiple manufacturers that had carcinogenic levels in their products, but this particular company had the highest levels, more than 200 times the acceptable limit per pill of this carcinogen, a regular blood pressure medicine pill that people take every day. This went on for at least 4 years before the FDA discovered it. When it finally got into the plant, it concluded that the company knew its product did not meet US standards, but sold it anyway to the United States and around the world. And that causes huge supply disruptions and access to critical medicines when the drug had to be recalled. As I've testified before Congress, Western generic drug company manufacturing is collapsing. This is causing drug shortages, more than what we've had. We've had 200 to 300 drugs in shortage before COVID. And the FDA, God bless them, they count every shortage, but for years, nobody did anything about it, which is really shocking. There's lots of reasons for that, and we can talk about it. Here's some of the lists of drugs in shortage. This was pre-COVID. And you can't, it's very small print. The point here is that on the left side are names of common drugs. And on the right-hand side, business decision to cease production, ceasing production, no longer producing it. And it goes on and on and on and on. What happened? There were, let's go back here. There were 3 Western generic drug companies, very large. I mean, they still exist, Mylan, Teva, and Sandoz. Mylan merged with Pfizer, its generic unit, and Pfizer that same year announced the opening of its global generic headquarters in Shanghai. The Israeli company Teva and the European company Sandoz, they announced in early 2019 that they were dropping half their products, generic products, because it's just not profitable enough. And so there's what's left. Now, some say, well, why not India be a viable alternative? India makes about 25% of our generic drugs, but as mentioned earlier, even India is dependent on China at the tip of the triangle, the core starting materials. It's like the rare earths story, exact same MO that's being used. So India depends on China. It was shocking to discover while writing China RX how India's military is dependent on China. Here we think India is a big generic drug producer, but for basic products like aspirin, acetaminophen, antibiotics like ampicillin, metformin. And we see what's happening along the India-China border. The risks are, I think, obvious by now. This is a Department of Defense official testifying before the US-China Commission last summer. And as I said in my testimony, medicines can be used as a weapon of war against the United States. You can send products that have nothing in them, have contaminants in them that pass under the radar of testing. That's what happened with lethal heparin that was sold to the United States. More than at least hundreds of Americans died, probably more. And this brings it home. This is a statement by one of the commissioners of the US-China Commission, retired military, 32 years, and he extemporaneously spoke up during the hearing, and he talked about the rocket fuel chemicals in his own blood pressure medicine. He said, my blood pressure medications were contaminated with rocket fuel. I imagine active people have the same problem, active duty military. This affects the readiness of our troops. And as I said, FDA cannot assure safe medications made in China. What do we do? I've recommended in my testimony to Congress and my briefings to policymakers that we have to start with using federal procurement dollars from the DoD, the VA, and the Strategic National Stockpile to prioritize domestic manufacturers. And we're seeing private hospitals doing the same thing. There's a consortium of private hospitals called Civica RX. And they started a new supply chain with trustworthy companies in trustworthy countries. And the first year of operation, they did contract manufacturing, and they've supplied their member hospitals, 1,200 of them, with 20 products. The second year, another 20 products. These are basic things you need to run a hospital with. And guess what? These hospitals did not have shortages during COVID because they thought ahead and they came up with a different strategy. And by the way, they're also saving money because when you have shortages, prices go up. And we haven't even talked about the impact on patients. This is the Civica RX story, which I think is really a remarkable innovation in using procurement dollars differently. It was started by Mayo Clinic, and now you can see here 1,200 other members. Kaiser Permanente just joined them with their 12 million members. In 5 years, they plan to have 100 essential generic drugs to be delivered. So this is absolutely fixable. And there's full transparency on location, price. They actually go in and inspect the plants. And there are a number of their products that are being made right here in the US. So they're diversifying the supply chain, decentralizing it, which is a critical strategy in the best of times, but also during a pandemic. This was revolutionary. These are lists of essential drugs that Civica makes, and they presented this to Congress. They're sharing where they make them. The API, and you have the name of the drug on the left column, where the finished drug is made and where the API is made. This tells me this is a group that is proud of where its products are made. Most companies will not tell you. And that tells me if you don't want to say where your product is made, then you have something to hide that you don't want your consumers to know. I'll just move right along here. Civica is partnering with a group in Richmond that got a substantial contract with the federal government. And the result is going to be fully made US generic drugs. This is a major step forward, and we need other domestic companies having the ability to do the same, to have contracts with the VA, the DoD, Strategic National Stockpile, and more private sector hospitals, Medicare and Medicaid, to be able to supply Americans with essential drugs so we have them when we need them. And it's another recommendation, China RX, was fulfilled when the FDA released for the first time an essential drug list, more than 200 products. That was done in the end of October. That's where we need to start. We're not talking about here reshoring the whole supply chain for every drug in the world. These are the most essential things we need as a country to survive. And I've been advocating for advanced manufacturing, continuous process that can make our products much cheaper, much faster, and real-time quality control. The FDA doesn't have to run around the world inspecting plants. And we can get into the economics of it. I'll just leave you on this note, and we'll get into the panel discussion. A gentleman who's built and run pharmaceutical plants told the story of going into a retail pharmacy to buy a common blood pressure medicine, 90-day supply. And the price was $157.50. And he said, guess how much the manufacturer gets paid? I said, maybe 20 bucks. $1. The manufacturer would be paid $1. So the question is, where does the $156.50 go? It's certainly not to production. So when people say, well, it's because of labor costs and factory workers and this and that, that's not true. We have to really break down the retail price and where the money goes. And there's plenty of room here in this pricing structure to allow for domestic production, quality medicines, security, and certainly the economic benefits that come with it. I'll stop there in the interest of time and look forward to a robust conversation. And there's my contact information. I welcome your questions, your comments. Please send me an email. This is a subject that's so important to our country for our biosecurity and survival. So thank you.
Rosemary, we have one gentleman that would like to ask a question. Would you like to take it now or wait until after the panel?
I'm happy to do it now.
Great. Let me see. Mr. Robert, you should be ready to go whenever you're ready to ask your question.
Okay, thank you. Can you hear me?
Yes, I
Yes.
can. Hi.
Hi. Thanks very much, Rosemary. Very enlightening. Back in the day, I think I was in the back row hearing your testimony, so I appreciate your perspective on this problem. I'll make it very quick. There's actually a million questions I'd like to ask you, but I've narrowed it down to two. People in my age range, which is over 70 and having a number of underlying health conditions, we're always looking for, pharmaceuticals that are inexpensive and effective. What would you say today, if you took the mark today, what percentage of my meds, if I'm a normal diabetic patient, what percentage of that would be coming from China versus the US if I went to the pharmacy today? That's part one of the question. And part two has to do with the carfentanil and fentanyl flood of China into our economy.
Well, on the fentanyl issue here, you can look across the country and there are shuttered factories, shuttered research facilities, and actually tell a story of a community in Connecticut where this happened. And I interviewed the real estate agents, the bowling alley people, the car dealership folks. And they said what happened to their community with the loss of these jobs is the drugs started pouring in. So we should start making legitimate drugs that people need, rebuild our communities. And that's one way to stave off the fentanyl. I think it's a reverse opium war, frankly. On your first point about what percentage of them, was that your question, sir? What percentage of them are coming from, or where they're coming from? I would just take the average of what we do know of 10% of our generic drugs, finished drugs being made in China. But I would say most of the drugs we're taking have some component from China. And I can tell you offline, there's an online pharmacy that was set up, and they test every batch before they sell it. And to me, that set a whole new standard. And I think there's no excuse for every other pharmacy that sells a product to do the same thing. And the cost is a penny a pill. A challenge there is you can't test your way out of this because the 2 cases of contamination that we've had, these are very deceptive contaminations. The first one in particular, the heparin, they were not picked up by tests at the time. So you can't test for everything. And ultimately making medicines comes down to trust. You have to trust people making the medicines you take to rely on for your health and your survival. Another reason to bring manufacturing closer to home so we actually know the people who are making them. But I'm optimistic with Civica RX that they, as they're partnering with groups like Kaiser Permanente and perhaps some insurers, private insurers, that there may be an opportunity to expand availability of US-made drugs on the retail side, not just the inpatient hospital side. Thank you, Robert, for your question.
That was the only question we had, so we can go ahead and go to panel 1. Dr. Gibbs, are you ready to go?
I am ready. Is everyone else?
Ed?
Yes, I'm here, ready to go.
Dr. Norris?
Also here, yes, ready to go.
Great, then we can have some extra time for discussion, and y'all can start when y'all are ready.
Well, thank you very much. So first off, allow me to introduce myself. My name is Sean Gibbs, and I am Dean of the School of Public Health here at Texas A&M University. And before we get to the panel, I'd like to thank the Scowcroft Institute of International Affairs at the Bush School here at Texas A&M for putting this panel together. I am certain we are going to have a very lively panel on the bioeconomy. We're going to be doing an overview on it. Just to give you an idea of how lively I expect this panel to be, during our preliminary discussion, and you guys can see the panelists smiling now, we got into such an in-depth discussion that Lauren had to stop us and say, essentially, hold this for the day of, because we had already gone an hour into what was essentially supposed to be a 15-minute mic check, just kind of to getting the discussions around there. So the first thing I'll do is go through and introduce you to our distinguished panelists, and then we'll hop in and start the panel discussion, and you guys can start putting out questions there to Lauren. So the first member of our panel you've already met, and that is Rosemary Gibson. Rosemary is the author of China RX, Exposing the Risks of America's Dependence on China for Medicine, which reveals the dramatic shift in where medicines are made and growing concerns about their quality, and it highlights the centralization of the global supply chain of medicines in a single country and the implications in the event of a global pandemic, natural disaster, or a geopolitical event. Ms. Gibson is Senior Advisor at the Hastings Center, and is recipient of the American Medical Writers Association's Award for Outstanding Contributions to the Public Interest in Reporting on Critical Healthcare Issues. She serves on the MedStar Institute for Quality and Patient Safety Advisory Board in Washington, D.C. Our second panelist is Dr. William Norris. Dr. Norris is currently an Associate Professor of Chinese Foreign and Security Policy at the Bush School of Government and Public Services at Texas A&M University. He teaches graduate level courses in Chinese domestic politics, East Asian security, and Chinese foreign policy. Dr. Norris has been an associate with the Nuclear Policy Program at the Carnegie Endowment for International Peace in Washington, D.C., where his work examined the potential for a conventional U.S.-China conflict to escalate into the nuclear realm. He was also a postdoctoral research associate at the Woodrow Wilson School for Public and International Affairs and a fellow in the Princeton Harvard China and the World Program, a joint program created by the two universities to foster the study of China's foreign relations. He completed his doctoral work in the Security Studies program in the Department of Political Science at Massachusetts Institute of Technology, where he specialized in the confluence of economics and security, focusing on the role of economics in contemporary Chinese grand strategy. Our third panelist is Edward Yu. Edward is a special supervisory agent in the FBI's Weapons of Mass Destruction Directorate and is currently detailed as the liaison officer at the Department of Health and Human Services Office of National Security. Mr. Yu is responsible for creating programs and activities to coordinate and improve FBI and interagency activities to identify, assess, and respond to biological threats or incidents. He supports FBI initiatives to build partnerships with the life sciences community, domestically and internationally, and leads efforts to identify and address potential security challenges in advanced biotechnology. His overall goal is to safeguard the scientific community, the life science research enterprise, and the U.S. bioeconomy. Before being promoted to the Weapons of Mass Destruction Directorate, Mr. Yu served as a member of the FBI Los Angeles Field Office, Joint Terrorism Task Force, and the FBI Hazardous Evidence Response Team. Mr. Yu also serves as a senior fellow at the Scowcroft Institute here at Texas A&M University. So as you can see, we have a very distinguished panel for you here today. So just to start off the discussion, I'll go to Mr. Yu and just simply ask, can you provide us, in your opinion, an overview of what is the bioeconomy?
Sure. No, first off, I just want to say thank you for the opportunity to be able to speak. It's an honor and privilege to be able to support this event. And just to kind of kick things off, bioeconomy is really basically identifying where biotechnology is really taking us. I think the best way of looking at it is there are some visionaries that have cited and stated that the 19th century was the era of the Industrial Revolution. And then the 20th century was the information age with the dawn of personal computing and the internet. In both areas, you saw significant global impact and acceleration of critical capabilities and capacities. Well, those very same experts and visionaries claim that the 21st century is going to be the age of bio, where they recognize that biotechnology and the various technology and applications that are going to be coming out are going to have similar profound impact, not only on us as a society, but also economically. And it's all going to be built on our ability to leverage data, right? So a prime example is looking at how, just within the last few weeks, we saw the announcement of these vaccines for COVID to be coming out in less than a year. And it was all built off of data, right? Once we got the genomic sequence of SARS-CoV-2, we were able to analyze that, and they were able to engineer design these vaccines. That's just the tip of the iceberg. And it's all going to be about data. And it's not just about how it impacts us at an individual level and our personal health standpoint, although my esteemed colleague, Ms. Rosemary Gibson really highlighted just some of the other aspects of the bioeconomy where you have huge implications to our pharmaceutical global trade. But the same implications apply to think of precision agriculture in our agricultural sector, additive manufacturing. When we look at how we potentially in the future can wean off of petroleum-based products and looking at new carbon sources from biological sources, and then even from renewable energy coming from bio. So ultimately, it really highlights that biotechnology is going to have a huge impact on our national economy, global economy, and therefore also has huge national security implications. And I can't belabor this enough that when we think about biological threat issues, we traditionally look at pathogens and toxins, emerging and re-emerging infectious disease. And I don't want to downplay it because we got hit smack, right in the face with COVID, and that's why we're holding events like this virtually. I mean, it's right in our face. However, we really need to expand the scope of how we assess biological risks and threats. And the bioeconomy as a context really highlights, again, how it ties to our economy and how it has direct impact on our strategic national security, which, again, I really want to acknowledge and thank Texas A&M for hosting, this event focusing on the bioeconomy. So I hope that helps kind of set the tone a little bit, but we can definitely go into it more at length.
Thanks, Ed. Next, we'll go to William, and I apologize to William because it's never a good idea to follow a man with a Klingon bat'leth in his background of his office there. So, William, just hearing what Ed had to say about the bioeconomy, hearing Rosemary's keynote here, I'm just interested. What are your thoughts, particularly around the influence of China?
Yeah, thanks, Dr. Gibbs. And if you are going to follow someone like that, you want to give him plenty of room. You want to be way behind him when he swings that thing. So I'm going to keep my remarks fairly brief, just to kind of get our conversation started. I agree with a lot of what Ed said, that the future really lies in this fusion of data and these other industries, the more traditional industries. And this is a realm, I'll extend that sort of now bridging over into the China side. It's a realm, I think, of competition between the United States and China. And the way I approach this topic area is primarily through the lens of my own scholarly work, which thinks about economics as a national tool of power. So as countries interact with each other in international affairs, how exactly do they use economics in those interactions? And that's kind of the subject, theoretically speaking, of what I look at. So I'm a little different than most of the other folks in the panels today, because I'm not really an expert in the bioeconomy, for instance, which is the panel that I'm on, nor am I necessarily an expert in pharmaceuticals, which is Rosemary's expertise. But the area that I tend to focus on is to really go deep and understand how exactly is it that China uses these kinds of policies and strategies. How does it fit into the bigger picture of China's grand strategy? And through that lens, I understand the bioeconomy as being one section of a broader phenomenon that I call economic statecraft, the notion of nations using economic tools of power in their relations with others. And to that end, I think one of the things that China is quite good at is coordinating a whole of government approach in a way that we traditionally in the United States have had a difficult time doing that. So you heard Rosemary's remarks, which I thought were a great way to kind of prime the pump for today's discussion. But for us, the notion of coordinating between the private sector and the industry and government is just fundamentally something that sits very uncomfortably in our own model of political economy in the United States, because we're premised on a free market approach that says the government should, for the most part, stay out of the way. There's a regulatory function, there's a sort of infrastructure, there's a market failures model in our own approach to the way that government interacts with the commercial activities that make that sort of coordination feel very uncomfortable for us. And it's quite different in China. In China, the assumption is that there is a lot more of what I call the domestic political economic infrastructure in place that facilitates an active role for the government in managing those kinds of commercial activities and commercial outcomes. It's not to say that the government directs everything that happens in China from an economic perspective. I came out with a book a couple of years ago on China's economic statecraft, and in that book, one of the core arguments is that this varies, that the degree to which the government can control the behavior of these commercial players changes from one context to the next. It changes over time. And so what I suggest in that book is we need to be a little bit smarter in how we think about measuring that phenomenon, how we think about looking at the factors that account for the conditions under which you're more or less likely to see the government being able to control the behavior of the commercial players in that space. So that's kind of the big academic theory. That is my area of expertise. That's what I get paid the big bucks to think about. And I think that to jump off our conversation today, it's really about, I think, on the US side of this equation, it's being able to connect that private sector with the policy government side of things and inform that with academic research. And I think that connection of those three legs of the triangle, or those 3 points on the triangle, I think is really the key institutional challenge that our own nation faces when responding to these sorts of things. It's one of the areas that I'm very proud of the Bush School for being out in front, I think, on a lot of this kind of work to help facilitate those kinds of conversations in designing an appropriate response to the nature of some of the emerging situations that we find in, for instance, in the bioeconomy. So I'll leave it at that for this opening, and I've got plenty of more ideas too, Dr. Gibbs. So just feel free to ask, and we'll move forward.
Excellent. That's wonderful here. Rosemary, I know you had 30 minutes to kind of open up and give us your thoughts here with the keynote, but I wondered if you'd like to jump in and kind of play off of Ed and William's introduction there, particularly around how it impacts the ramifications from your book, China RX.
Well, first of all, I'm so impressed and delighted with the panelists, and Ed, the way you describe the bioeconomy, its broad scope is absolutely brilliant. I focus on a very narrow piece because I'm so eager to fix things, at least to get something going, because we have to know where to start. And I think when we realize that the medicines we give to our kids, we don't know where the heck they're coming from, or they could be problematic, for making policy and making change. We look for motivators to know what to do and how to do. And I want to give people hope that there is a pathway to fix these things. And, I'm a student of economics in the London School of Economics, and I think about public goods. And public goods are those things that are where there's market failure. So there are lots of instances where we as a society have governments have invested and work with the private sector, whether it's in agriculture, because we know that there's some things these are strategic assets. So I think a first step is identifying what is a strategic asset, a thing that a country needs to survive. So it's food, it's energy. We get involved in energy. And I want to add medicines to that list. And I would love to hear from Ed, what are those things that are so critical, products that we can understand, that members of Congress will understand, that, we absolutely need to have capability here. And at the right time and right place, government and business can get together, but it has to be done in a way that's in the country's interest. A lot of folks that want to, just come to Washington to, because it's financially advantageous. But where is it that we can lay out a path to make a difference? What does that look like? So that's my thoughts about the bioeconomy. I'm just really honored to learn from everybody today, and also from those who are participating. I see in the chat that we have some really very talented, knowledgeable people here. So I hope everyone will chime in.
So Ed, Rosemary kind of tossed it back to you. Would you care to elaborate and expand?
Oh yeah, no,
Sorry, Ed.
no problem. I appreciate it. So I guess one way of I really set the stage at showcasing how the bioeconomy is incredibly critical for the success of the U.S., not only today, but in the future, and how it's going to be dependent upon data. And this is how I tie in with Professor Norris's perspective, that if it's all about the data, the end game is whoever generates the largest, most diverse data set is going to really, truly own the day. And with that in mind, if you take a look around, who has access to the data, it's China in spades. And I don't think we really appreciate what the strategic dominance that gives them, and not only just today, but especially tomorrow. So if you turn around, not only have they dominated the pharmaceutical market, as was, depressingly articulated earlier, but they also dominate, for example, the DNA sequencing market. So if you want to do large-scale DNA sequencing of human, plant, and animal, majority of the companies are Chinese. And if they're not the biggest, they definitely are the best priced. And many of these firms they're certified to do clinical testing. They're HIPAA certified as well. They probably meet or exceed cybersecurity guidelines. They're even eligible for Medicare, Medicaid reimbursement, so our government would pay them for their clinical services. And even more importantly, they're probably Federal Acquisition Regulation certified too, so they can actually put in bids for government contracts. And it's not just in the US, there are also indications of Chinese entities providing non-invasive prenatal test kits all around the world. So they're getting access to genetic information from expectant mothers and their children, for example. Syngenta, for example, large agrochemical company acquired by ChemChina. I think it's still one of China's largest foreign acquisitions to date. But one of Syngenta's offerings to our farmers is precision data analysis for their land use. So they leverage artificial intelligence to look at drone and satellite imagery data. But then are we inadvertently giving them insight as to what our crop futures might look like, or what farmers might need, what agrochemicals or modified seeds they might need? So the bottom line here is that they have tapped into data. And the aspect of that is that it's all one way, that there is no data sharing reciprocity. The Chinese government had put in laws that went into effect last year where they absolutely control any data access in their side, especially when it comes to biological data and samples. So what this means is that they're on par of building the world's largest, most diverse data set you can think of. I mean, they build strategic partnerships with countries around the world to offer clinical testing as well. But we don't get to see any of that. The downstream impact is that, and this is a long way of getting around to it, but most of our focus has been on how do we protect our intellectual property. I don't think we recognize that IP is the finished product, right? We've done all the research, we finalized it, we patented it, we licensed it. Well, what we don't appreciate is that if someone like China, entity like China, is gathering all the data, once they are able to accomplish true artificial intelligence, true machine learning, true even quantum computing, then they can turn that loose onto the data and they can design and engineer new products. So that means that they're going to dominate the future IP market. So not only is it for the near term, we might potentially, the nightmare scenarios, we might wake up one day and realize we've just become healthcare crack addicts and China becomes our pusher for all our healthcare, pharmaceutical, and therapeutic needs. But by them having all the data in residence today, if that translates into future IP, the take-home message for us is that for tomorrow, that might translate into future co-opting of market share, new business models. All the future job opportunities are all going to be over there. They won't need to come to the US anymore. They won't need to steal our IP anymore or conduct economic espionage because it's all going to be over there. And what happens if that occurs and we find ourselves, we're in second place in a two-man race? Not only is that a huge impact to us from a strategic standpoint economically, but, as a democracy, are we okay with that? And I don't think we really understand, what the long-term implications are. And I'll just put this final point on it, that we really need to start looking at the bioeconomy as the equivalent of a space race, right? It's not just a tit for tat trade or negotiation kind of thing, but understanding that, the huge impact as a whole of government, whole of academia, private sector, and even society requires a space race acknowledgement of it's not just about playing keep away or defense, but it's also how do we set ourselves up to run faster and maintain or even increase our innovation lead and our leadership on the global stage as a democracy. So apologize, I may have pontificated a little bit there, but I really wanted to kind of tie in and really highlight just really what's at stake here, not only in the near term, but especially even more importantly in the long term.
So, William, it looks like you have some thoughts, and I was just about to go to you.
Yeah, I was just going to say, building off of what Ed said, I think he's exactly right that this is, and whether you equate it to the space race or some other sort of national level effort, I think we're in that catalytic moment right now as a nation where we need to think about what's the best way to do this sort of a competition. I think it's been quite clear there's a real shift in terms of our relationship with China. And as a nation, we've sort of shifted into this competitive mode with our relationship with China. And when we do this, I think it's important to think about that long term. And one of the challenges I think is how do we go about doing this? Okay, great. So now we're in it. How do you run that successful space race? And here again, I go back to what Rosemary was talking about in terms of market failures, and we have to think about what do we do really well, and how can we strengthen those kinds of things that play to our own nation's best side in terms of our experiences and how we do these sorts of things. And at the same time, we need to do that recognizing that everybody else in the world knows what we do really well too. And so one of those things that we do really well, as Ed was talking about, is on that intellectual property side, the innovation side. So we've had for decades a model of innovation, coming back to the university environment, that's fundamentally predicated on openness and sharing and collaboration, and having that model be one that has served the United States very well. So the challenge now is, what do you do if that model is deliberately and directly targeted? That openness, that element of openness, is deliberately targeted in a way that that seeks to exploit that and take advantage of that. Is there a way that you can still be able to maintain the benefits of that sort of a research and development architecture enterprise, while at the same time being a little bit more savvy and cognizant of the realities of the environment that we live in today and the situation that we're facing? So one of the big themes that I suggest is it's really important, I think, to develop a much deeper understanding of China and how China thinks about these challenges, how China works, how it functions. And it's important to recognize they're not 10 feet tall and invincible, but they do have a game plan, and there is a grand strategy there. There's an idea, there's a theory that gets them from where they are today to kind of what Ed's laying out there in the future and what the vision looks like. And I think to the extent that we're serious about preserving the U.S. position in international affairs, I think we need to give a lot more attention than we have so far to what that looks like and how that seems on the other side. The second point I wanted to bring up, one of the things that I do at the Bush School is run a program on economic statecraft. And in that program, we've come up with this way of thinking about this phenomenon that I think gets at remarks that Rosemary started out with earlier, and I think that fits very well with what Ed was just talking about. When private commercial actors do their business, so defining economic statecraft starts with this idea that economics is not really something that countries do per se. Sometimes international relations will use shorthand and talk about economics of Great Britain or the economic policies of France, but it's really only the government's role is more like a referee on a football field. It's not, the referee's not actively involved in the game, but the referee could fundamentally change the way the players play the match, right? I mean, they could change the results by making a call or deciding to let things go. So that's the way you should think about the role of states in this. But the real players on the field are the companies involved, the commercial actors that Rosemary was talking about. And so when I think about economics, I think about states influencing the incentive structure that those commercial players are facing. And the reason that they do this is because sometimes those commercial players do things for reasons that make perfect sense from a commercial logic. But those activities in aggregate or individually could have externality effects on nation states. And that's the way you should think about, I would suggest, economic statecraft, because it's those security externalities that are developed, whether deliberately or inadvertently. In some ways, I say that doesn't really matter, because the net result, as Rosemary was talking about, is there are some of these things that countries just need to care about. There's some of these things that go beyond the P&L of an individual firm, that in aggregate as an industry, if we outsource all of the generics to another country, there's an externality there for the nation state, which I think has been brought home in spades this past year with COVID. So when you have those market failures, when you have those public goods that are being underprovided, when you have something that a country cares about from a security perspective, then you're in the realm of security externalities. And then I think you can start thinking about, well, what do you do to shape the incentive structure facing the commercial firms that are responsible ultimately at the core for those externalities, for that security? And I think that gets us to Ed's point about how do we run this competition? How do we use government support to prime the pump for basic research, to gently guide the overall trajectory of an industry in such a way that's going to be more conducive to US security interests? And I think the best way to do this is really through that basic R&D. That's the big area where government, I think, tends to drop the ball, particularly if you have year upon year upon decade of reductions in some of that basic R&D support, then you are really starving the future productivity in terms of that IP pipeline that Ed was talking about. So I think it just begins a conversation, helps frame a conversation about what do we do from here and where do we go from here. And in terms of that, I would say, know a lot more about how China works and what China's doing, and know thyself, and know what we do well and how we can position ourselves to most effectively respond to that data that we're seeing coming from the Chinese side. Over.
So before I move to Rosemary and let her expand on this, I do want to clarify, Texas A&M University does not require our faculty to make football references in all of our presentations, but it certainly doesn't hurt with your annual evaluations, does it, William? All right, Rosemary, I just wanted to throw it to you and see if you wanted to expand upon what William and Ed had to say there.
I think what William and Ed are talking about is so important for every sector of our economy, bio and beyond. And I think it requires sort of an awakening of what's really going on that's not in front of us. We're so busy doing what we do every day, but we don't step back and see the big picture. So I've been heartened to see that certainly in the generic space and other sectors, companies now, but they were forced to go back and look and find out who their suppliers are, and who their suppliers' suppliers are, and who their suppliers' suppliers' suppliers are. In an age of Amazon Prime, you just go, put in a few keystrokes or taps on your phone and stuff gets magically delivered to your office, your business, your house. And we don't think about that whole thing called supply chain. And by necessity, and that's the benefit of COVID, you see that where things come from. So I was in a Home Depot the other day looking to buy a refrigerator. You can't get, there's a lot of refrigerators that are out of stock. And so they're selling these, very 10 cubic foot small ones to tide people over if their refrigerator breaks down. So why? It's not just because people were sick and couldn't get to work. There's, where do the supplies come from to make basic things we need to function in life, like refrigerators? Let alone the high-tech equipment that, that the Department of Defense needs for telecommunications. So this has forced us, and there have been shortages of certain products. I go to buy them and just can't get them. So this is forcing us, and I think this is a silver lining of COVID. Should we choose to take on this search to understand where we are dependent? But then the next step is to come up with Plan B and execute it. One of the most heartening things I heard from a gentleman about China RX was he works in a bio company and he read China RX, gave it to his CEO, and the CEO had him do a presentation to his board. And the board ended up making decisions for the future of their company as risk mitigation measures that he said were much better for its future. And that's the kind of space we have to be in. We have to think the long term here of, I love what Ed says. We're going from what it was designed in the US, made in China, but it's now going to be designed in China and made in China. We'll have nothing. And if you want your kids to have jobs, what's that all about? So I think the good thing about COVID, it's forcing us to go back and look at where things come from. The second thing I want to underscore is, how do we communicate this to a broader subset of people? Bioeconomy sounds very complex. I think it's important to kind of break it apart and make it understandable to smart people who are busy doing other things to grab their attention. So I'll tell you the kinds of things that grab my attention that I look for. In Washington, D.C., there's the metro system. And the metro company was going to put out a bid for new rail cars. And fortunately, people were looking, and all the congressional, the senators from the Maryland and Virginia weighed in and said, you better not buy train cars from China, because they're going to put facial recognition technology on, and they'll see where everybody is going. Those who work at the Department of Defense, the VA, members of Congress, executive branch, legislative branch, they'll know where they're going every day. And plus, with free Wi-Fi on the subway, they'll be downloading everything and getting into your systems. So, and they threaten to take away, if you do that, then we'll take away your federal money. So these kinds of stories need to get out into the media. This is beyond bioeconomy, but it's about telling a story in a way that people can take pieces of this bioeconomy concern and make it real for people and say, gee, that doesn't make any sense. And I think through good communication of complex matters, something that I really struggled with writing China RX, that was the toughest book I've ever had to write. How do you communicate this? So people would not be turned off by it, too scared. I'm supportive of industry, but we have to be smart about it. I think how we communicate this and what issues do we pick as sort of leaders, leading issues to grab people's attention so we can work on it.
So I think that's kind of a lovely segue into one of the questions I got here. So as some of you may have noticed, we just had a national presidential election. There were a couple news articles about it, I think, so you may have picked it up there. But with this change in administration, with this transition, for our three panelists, if the incoming administration were to come to you and say, what are the 2 or 3 areas within the bioeconomy that we need to make a U.S. priority in the next 4 years in order to make sure that we're well positioned and positioned properly, not just for the next 4 years, but for the next 50 years? I'm kind of curious, what would be at the top of your lists?
I'll just start off by saying we need a public-private partnership to support the rebuilding of antibiotic fermentation plants. Start with 1, start with 2. Use it as a loan, line of credit, and with, it's not open-ended and not tax incentives, but you have to produce product within X period of time. And you'll be assured of a contract from the Veterans Affairs, Department of Defense, VA, and I'm sure private sector hospitals would want to buy from them also. So you have public-private. That's one place, very practical step. It's already been talked about, but it hasn't been acted upon. And it has to be done in the public interest. This isn't about venture capital coming in, and it's like a public good. What we were saying, William, market failure. These are public goods, and it's not for people at the time for people to come in and gouge the taxpayer. This is sort of a long-term investment where you can make a reasonable rate of return, but it's something that's so important for our country for survival. That's one very concrete recommendation I would give. And then once people get into that, then they begin to understand this space, and then it creates an opportunity for dialogue. well, gee, there's other things that we need to do. We develop relationships. Remember, we haven't had these relationships, as William said before. What's the private sector and government? We haven't worked together on these issues. So this is sometimes you have to start working together on a very concrete project with a set goal. And then that creates relationships and dialogue that get you, further down into solving related problems.
Ed and William, same questions to you. And William, I saw you unmuted first, so we'll go with you there. Sorry, Ed.
I buzzed in, right? I buzzed in
Yeah,
quick.
Jeopardy rules here. Jeopardy
Yeah,
rules.
thanks, Alex. What is? So I think the first thing to bear in mind is this new team that's been announced so far. These are folks that have they've been in the Washington world for quite some time. They've known each other for quite some time. They're going to work very well together. So I'm not going to pretend to be able to tell them what they should be doing. That said, they're also going to be well aware of something I think, and this may not be the ultimate source of this, but I know Rahm Emanuel, I think, was credited with saying that you never want to let a good crisis go to waste. And so this COVID crisis is front and center for this incoming team, and they are dialed in on it. So they're gonna think about what we need to do to fix this problem. The one thing I might remind them about is you don't want to fight the last war, and there's going to be a strong tendency to plug all the holes after the waters leak through the dike, and that's good, and that's a smart thing to do. But one of the things I think you heard in Ed's comments, and I think is embedded in Rosemary's perspective, is you also want to look around the corner and anticipate the future risks that may emerge and the future things that you need to do, take action on now today to inoculate the system against those future risks. And I think that's something that sometimes does get a little bit lost in the shuffle because there's so much noise and attention and light and smoke around the existing problems that we're facing right now in the moment when you're in these positions serving in government, that I think it's easy sometimes to forget to look beyond and to anticipate what's coming down the pipe. I think that can be a little bit harder to do when you're sitting in those positions in office. The second thing, which I think is already baked into their DNA, but I think you want to make sure that you listen to the science and make these decisions based on the data. So there's scientific needs, but there's also economic data, there's economic realities, there's market information that is going to be required to inform where you put your chips in terms of the bioeconomy. Where's the best bang for the buck? Where's the place where it makes the most sense to forge these kinds of partnerships that Rosemary's talking about? What's the best way that the government can usefully and constructively contribute into that long-term competition that Ed was talking about? And then my third point here is, I think it's important to not try to beat China at being China. China's system has 5-year plans. They've got 14 of these, a track record of having put together 14 of these. They have picked their strategic emerging industries. They picked their national champions, and they put a ton of resources up against those efforts. There's a reason to think that might succeed to a certain extent, but that is certainly not who we are as a nation in the United States. And if we try to beat China at China's game, I think we're going to set ourselves up for a very big disappointment. And not only are we going to lose contact with who we are and what makes us efficient and competitive, but we're not going to play that game better than they can. And so my third point is to say, at the outset of the Cold War, at the Sputnik moment that Ed alluded to, when 1957, you get the beeps coming from the orbiting satellite that the Soviets put out there, Eisenhower recognized that this is the beginning of a long-term marathon competition. And he was deeply concerned with how the United States structurally ought to best respond to that long-term competition. And guiding that thought was, how do we, and this is where I think Aaron Friedberg's work on why the United States doesn't become a garrison state in the early Cold War is really instructive, because Eisenhower said, we can't compete with the Soviet Union the way the Soviet Union is competing with us. That's not who we are. We're not going to create this huge military industrial complex that we're going to use to outcompete them. So Eisenhower puts us on a lot of, at the time, relatively out of the public eye efforts to compete effectively with the Soviet Union. But what does he do? He creates huge investments in the US highway system, a big infrastructure investment in the United States, ostensibly for worst case scenarios in the Cold War, but has the effect of linking the United States economy domestically, this huge geographic expanse. And everybody has Route 66 and the American dream and the 2 cars and a dog and the the home in the suburbs, and it fuels this big economic expansion. So it plays to the strengths of who the United States is. He also invests hugely in primary STEM education, science and technology, engineering, mathematics in the United States as the way to move the technological state of the art in the competition with the Soviet Union. So I think where we are today, I think I think Ed's comments are exactly right, that we're at the beginning of the similar kind of space race type thing, but I'm not thinking Kennedy space race. I'm thinking Eisenhower space race. When he's thinking about the Corona satellite program, he's thinking about all these things that happen outside of the public view, but are nonetheless an important way of responding to the emerging challenges that he sees in his administration. And generally speaking, when the photographers are out and the cameras are on, he's out playing golf on the golf course, right? So it's okay, it's all good, we're good. You know, this is the post-war American boom when everything is coming up roses in the 1950s, when below the surface, there's this intense competition that's being kicked off in the US national security apparatus in particular, thinking long-term about its competition with the Soviet Union. Over.
Ed, your thoughts?
Yeah, so I'm fortunate in that I get to build off of some findings and reviews from a body of experts. So in my time at the FBI, I hosted a series of workshops, first with AAAS, the American Association for the Advancement of Science, and then the National Academies of Sciences, and brought in experts from places like Microsoft, Intel, IBM, Dell, Amazon, and challenged them that, you know, this is the future of the US economy built on biological data spanning multiple sectors. Where are we with national security? And the overwhelming response is that we've done a lot, especially on the health side, on privacy, but not a whole lot on national security. And one of the prime findings was we don't have a strategy. If you have a space race, you need a strategy. And so riffing on Aggie football, it's not just the referees. We need offensive and offensive coordinators, someone who has a high view to see how do we position ourselves both on the public-private partnerships, as well as what's happening, what the other teams are doing, and being able to position ourselves, right? And looking at it that way. So we're not looking at it, unfortunately, in that broader perspective. So it translates into some very specific things. From a national security standpoint, for example, the bioeconomy really serves as a context of how everything's converging. Right? It's going to be an aggregation of data, artificial intelligence, telecommunications, how that translates it into drug or vaccine manufacturing, improving agriculture. That also means that we can't look at risk assessment or look at security assessments the same way. We can't look at them in silos. We can't look at AI in isolation. We can't look at telecommunications in isolation. We need to look at this holistically. And we're just not set up to look at it that way right now. And therefore, not only are we falling down potentially in looking at technology assessments from a vulnerability standpoint, but again, from that offensive coordinator standpoint, we're potentially missing greenfield opportunities, right? To put the government in a position to say, hey, this is where we want to go. What is the bioeconomy equivalent of? We want to put a man on the moon, or I should be politically correct. We want to put a person on the moon. How do we get there? You know, and so historically speaking, we've been completely dependent upon the private sector to kind of lead the charge. And we've been sort of responding to whatever new breakthrough there is. We haven't given them the guidance as this is what we want to accomplish as a country, as a nation, and how our students can then, translate into the workflow. That kind of big picture to provide the guidance and then to set up not only the technological infrastructure, but the policy infrastructure to help facilitate that is just not there to set that up. And then that also translates into foreign policy. And I like Dr. Norris's analogy of the space race, because in the Soviet era, we didn't go to just from a military to military, but it was also all about coalition building, right? It's how do we spread the like-minded fellow democracies, help establish democracies, because at the end of the day, it's not it's the authoritarian regime, and from our perspective is how do we protect the rights of an individual and ensure their prosperity. That's what our proposition is. What are we doing in that sense? We're the U.S. We did not participate in COVAX, right? The COVID vaccine international alliance. That left a huge leadership vacuum on the global stage. But then who stepped up and filled the U.S.'s spot? China. And you see that happening, everywhere else and around the world. We are just no-shows. And this is really telling. So as I sort of articulated this, but I'll go into a little more specifics. But in the U.S., historically speaking, we provide a lot of health assistance in Africa, through two Ebola responses. I don't want to downplay that, but ultimately that's just putting out fires. That's still dealing with an acute situation. China has built out their infrastructure. They have also built out their health infrastructure. They're offering low-cost DNA sequencing at large scale for clinical assistance. They're building out their health infrastructure, both technologically as well as physically. So they're in there for the long haul. The problem is that even if you give those representatives in that country, like, this is the price you pay in the long run, with dealing with, the price with dealing with China. The response was, and this is really telling and impacted me, the response was, well, you can't beat democracy, right? What is our alternative? If we don't have any viable alternatives, we have to go with what they're offering. And so that's the other aspect of the space race analogy, that we showed up to play. We showed up to show that this is the viable alternative from back then, the Soviet era, on what they were trying to make their mark on the global stage. So it's not only looking at what are our opportunities to advance the US's bioeconomy and maintain our innovation lead, our economic standing, but it also is, what does it look like? How does that translate on the global stage too? So I hate to say it, but how many people understand that even within China, right, they are actively collecting biometric information on their own population, not only for their healthcare needs, but they also translated it. They use DNA information to identify ethnic Uyghurs. And they're corralling this minority to the tune of almost millions into these re-education camps. And that data is fueling what I call discrimination in high definition. That transcends privacy. But we do not get the national security implications on how our data could potentially be misused if it got out. If you're a victim of identity theft today, you can change your PIN code of credit card. But if your genetic information is taken, once it's gone, it's gone. There's no getting it back. So there's some real felt issues at a very individual level that I don't think we understand. But then even at a national level, without a strategy, without a broader perspective, we're going to be, not only are we going to get hurt, but we're going to be missing out on some very significant opportunities. And we have to find that balancing act.
Hi,
Rosemary, I can tell you're ready to go.
Yeah, I just want to jump in. How did you know? I'm a very bad poker player. So Ed, what you just said got me thinking about, this takes resources. And we have our national debt is $27 trillion or something now. And our economic base clearly has eroded. And I attribute that in part that we stopped making things. And we went from a net creditor nation to a net debtor. We used to loan people money around the world, and now we owe people money around the world. So how do we rebuild? What is our economic base 5-10 years from now? It's one thing to innovate and to design, but we also need to have the capacity to make things. How many innovations have come from this country, but others are making them? They're making the products that we came up with brilliant, brilliant innovation. And so how do we preserve and protect what we have now? And that requires, I think, a perspective that companies need to protect from a security perspective, the theft of their intellectual property, driving them out of business. There was a company, very famous company, they had a medical device factory in China, and China just stole it. You have companies here that are making things here, they have their business operations here, but there was a back door by a very sophisticated state actor that was stealing everything, not just their R&D, but also their business plans, their operations, their customers. So I think a first step, we have to sort of batten down the hatches and protect what we do have here from theft. and then continue to invest in making things. There was a great article by a gentleman at Harvard that when you make things, you it gives you impetus to innovate. You think, well, how can I make it better? And so when we stop making things, what's our capacity for innovation? It erodes. I just want to put a plug in that because what's going on here is very clear as an economic war. We talk about the Soviet Union and what happened there. It was, an economic. Economically, they could not compete. And so we have an economic war going on that people don't want to talk about, but that's exactly what it is. When you have deliberate strategy to undermine the future companies, this is not just, industrial policy. This is a strategy to take down your vital industries. And we're seeing it happening before our eyes and happens very quietly. You don't hear about these stories at all in the media because they have investments in China and they don't want to report it. They can't report it because then they'll be threatened. So it's a very, very serious problem we have. And so I totally agree with the vision and practice of what we need to do. I'd also say, Ed, from a government perspective, I don't think we even have a structure in government. Maybe we need to come up with one. You need a structure, a place, you need people, and you need a process to be able to do exactly what you say, because I think it's right on. But we also need a strong economic foundation to be able to afford to do this work and to make those investments. So I'll stop there.
So no pressure at all, Rosemary, but so far, 2 of the 3 panelists have made reference to Aggie football. If I can get 3 of 3, I think I get wonderful evaluations at the end of the year.
I'd embarrass myself if I tried to make a reference. I'm sorry, folks.
We've got about 15 minutes left of panel discussion. One of the key things that I've heard across the board has been the U.S.'s history in coalition building, the U.S.'s history in kind of open science, and how that's been a bedrock in what we've done. How can we build on that history as kind of an opportunity to push us forward in the future towards putting together a national strategy for the bioeconomy?
Well, I'll just jump in real quick. I just had a conversation last week with folks in the EU, and there was some talk about the EU as well as Japan and other countries, India, to invest in domestic manufacturing of essential drugs, and that was very promising. But then I just saw a statement that came out last Wednesday from the EU Commission saying, well, they're going to study the problem for 2 more years. And this is, they're coming off a pandemic where you couldn't even get acetaminophen. You could not buy acetaminophen in Europe. It was sold out. There was a shortage of it. And part of the problem was the core starting material came from China. So and the purpose of the conversation I was having last week was, could there be a partnership between the EU and the US to really promote a partnership and coalition to help each other out in rebuilding an industrial base with trade, export, and so forth. But now the EU Commission has come out and said, well, we got to study it a little bit more.
So I'll start just very quickly, and then I want to hand it off to Ed, because I know he's going to have the real answer. So I'll just give him a little bit of time to prepare his remarks more in a tightly formatted way. I'll say the good news is the United States is operating from a position of strength. So we already had been the destination of choice for the best and the brightest of the higher education researchers. If you were from anywhere in the world, if you really wanted to make it big, you wanted to make it big in an American postgraduate research environment from an academic perspective. That's a huge, huge advantage that the United States starts with in this equation. So I would say that the first thing is to remain that paragon of excellence from the R&D side, from the innovation side, at the front end of the pipe, the basic research. You want to make sure that continues to be the fact in the international community. You don't want it to get to a point where people are like, well, I had this great opportunity. I'm a rising young star coming out of New Delhi, and I'm thinking about where do I want to go for my postgraduate education? Should I go to Tsinghua in Beijing, or should I go to Caltech? Like, that should be a no-brainer. You want that to be like, it's a slam dunk, no-brainer. This is where I need to go. So I think that's the first thing to point out, is that we have this huge lead and this huge advantage right now today that we want to make sure we don't squander. The second thing is on the immigration side, we have traditionally been a country that has welcomed the best and the brightest. And in some ways, immigrants are a really interesting bunch, because these are people who are leaving everything they know from their homeland, all their friends, all their family, all their language, all their culture, all their history. And they're saying, you know what, I'm going to roll the dice because I think I have a better shot in this other country called the United States of America, where maybe my kids could be a little better off. Maybe I could really realize my full potential. That is a second huge advantage, which I think is distinct from that first one. So there's a big status quo sort of first mover advantage in the innovation space from the industry, from the economy, from the university, from the academic side. We are starting this from being way out in front. That gives us a big advantage. I think it's important to cultivate that and to not let that get eroded. The second one is on the immigration side, the pipeline of future talent, and continuing to be that beacon that draws these crazy people who leave everything they know that's safe and secure, and they come to this new place where people are going to hate them and discriminate against them, and they're going to be like, yeah, we're going to give it a shot though, because I think it might work out. And we've got decades and generations of people who have made this decision, and that is a huge source of advantage in our country, in my opinion, because if you look at the data, those folks end up being real rock stars down the line. And maybe it's not the first generation that shows up, maybe it's their kids or their kids' kids. But generally speaking, those are a unique kind of human being that wants to roll the dice like that. And they tend to combine hard work with this notion of brights and potential and drive. And those things are another big human capital advantage that we have going for us. So I'll preface it with those two. And the last one is one that Rosemary just mentioned on the EU. I think if you look around and you think about these international coalitions and other like-minded folks in this long-run competition, I think you look at the gravity in terms of a gravity model of trade or economics. The European Union seems to me to be a natural and in some ways an indispensable partner in this long-run competition. The problem with the European Union is that they're still going to be the Europeans. So they're going to have their own way of doing things. They have their own calculations of national interest. They're going to have a difficulty operating together in a cohesive unit because at some level, individual nations are going to have some divergent perspectives and divergent interests. I mean, this is not new for us. This has been the case for a long time in the 20th century, and I'm confident that we can manage through that as long as we keep our eyes on the big picture, which is the big picture is we have a lot in common. We share a lot of common interests. And that's, I think, where you can build progress, where you're able to make progress. I think that in addition to the European or Eurocentric geographic orientation, because I'm a China guy, I would suggest that there's an Asian dimension to this as well. And there, I think we have a lot of potential for partnerships in Asia that will be newer, and a little bit more different from a strategic perspective than the European one is. But again, we've got a long history there with the Japan-US alliance relationship that goes back just as long as the NATO stuff, a little bit later than NATO, but not by a lot. And so there's a long history there building on these partnerships with South Korea, with Japan, with India, with Australia. We have a lot of good friends and allies in Asia as well. And I think those two centers of geographic gravity. And then the last one is the continent of Africa, which has a huge potential in the 21st century. And it has historically been overlooked by the United States in our own foreign policy. And so if that were to come to fruition, if they were able to realize some of their potential, that would be a third that I would suggest out there in terms of where to turn. That should have bought enough time for Ed to give you the real answer to your question.
I appreciate it. My challenge is how do I stay within keeping of the time? From an international policy perspective, I just want to leave you with one technical thought, and then I'll scope it out a little bit more. That if you look at the future bioeconomy that might be built on not only biodata, but biomass, so looking at where in the world is the highest concentration of biomass, like look, I'm talking about like tropical forests, where not only is just a sheer bulk, but the biodiversity of new organisms that might produce the next cancer therapeutic, right? Those are all just below the equator in Southeast Asia, Sub-Saharan Africa, and South America. if you look at it from that standpoint, where is the US from a foreign policy standpoint? We're sort of not there, right? You know, the South China Sea is sort of on our radar, right? I mean, for obvious reasons, but for the most part, we're not there. But if we're not there, guess who is there? I mean, if you look at China's Belt and Road Initiative, what they've done both in South America, owning most of that entire continent's debt, as well as Africa, you know, they're the world's largest growing mobile communications market, mostly Huawei phones, for example. Bottom line, they're already all over there. So in the future long run and access to biomass and biodiversity, they're already there from a foreign policy standpoint. It also means we have to look at strategically thinking, that offensive and defensive coordinator position. What are we looking at? How are we positioning ourselves, right? But to that end, though, it also means that we have to rethink or augment our standing international engagement, whether it be the Biological Weapons Convention, right, Australia group, you know, looking at the various biodiversity, looking at bringing in the bioeconomy perspective to help our partners, our future potential partners, because it's not just about US first, but it's also, if we really understand that what's at stake, it's also helping those fellow countries understand what their risk is as well too. It's not just about US first, but it's how do they protect themselves, right? If in the future that this becomes a health diagnostic tool, not just a data storage aspect, then that should be a wake-up call for individuals all around the world. You know, who are you going to be allowing to get access to your health-related data? So that's looking at it on multiple levels for multiple countries, but it's really helping them understand that it's in their best interest to help to understand this, not just the trade war or traditional warfare aspect that we've looked at from a foreign policy standpoint. Then I'm going to boil it down to, and I really appreciate you know, Dr. Norse's perspective on this. Universities, you know what, you have a lot at stake as well too. That absolutely we need to be bringing in our foreign scholars and foreign students. However, I think there's also a missed opportunity, right? Historically speaking, yes, we train them to be incredibly technically competent. What are we doing to help them understand what our ethics and values are here in the US? How do we conduct ourselves here in the US? How do we ensure the protection of individuals' liberties and individual rights and how a democracy operates? And how within that context, science is able to excel in this space, how innovation is going to be leveraged for beneficial purposes. That's a missed opportunity, I think. And so let's not miss out on that, right? I'm going to get on my soapbox a little bit. But for example, from a biological training standpoint, not once in my entire experience as a student from middle school all the way to graduate school, not once was the Biological Weapons Convention ever mentioned. And yet this is an international treaty that's still in force and that every biologist is beholden to ensure prevent the misuse of biology for offensive purposes. Why aren't we taught that? Why aren't we taught why something like that exists in the first place? So it's missed opportunities like that that we don't, train and expose our foreign scholars and foreign students when we bring them into our country. This is why you do want to come here. It's not just because I would throw in Texas A&M as well as Caltech and MIT up there, just saying. But give them that the opportunity to understand our history, not only our successes, but where we fell short too, and understand that empower, embolden, and educate them as to how, from a scientific standpoint, we want to prevent the misuse and exploitation of science and how it gets translated. And whether they stay here, great, but if they go back to their home countries, even better, because they're bringing those norms, that experience with them as well too. Maybe they'll become future scientists, future leaders, business leaders, or go into policy as well. So it's how do we look at not only really running fast ourselves, but how do we make sure we protect the bioeconomy, protect science, safeguard science. There's a reason why I like using the term safeguarding the bioeconomy. It is everybody, all hands on deck kind of aspect of protecting and preventing the misuse and ensuring that nobody's left behind or marginalized. But those aspects we just don't train our scientists when we bring them on board. So just my attempt in trying to cover the spectrum of both international policy all the way down to what can we do to really empower and educate our students as we bring them over. Not only for our US students, but especially the foreign students, because I don't want that to be a mistake. So I hope that hit the mark.
I really like what you're saying, Ed. I agree with you wholeheartedly that there's a missed opportunity to take a lot of these students when they do come over, and not just students, but faculty as well, and to begin to engage them in some of these important questions. And that's one of the strengths of a democracy. We are not afraid of having a free and open discussion of these very difficult and often challenging ethical issues that are fundamentally in the heart of the bioeconomy. I think it's really important that the technology specialists help lead a lot of that discussion in the same way that Robert Oppenheimer led those kinds of discussions during the Cold War on the nuclear realm. I think it's really important that bioethicists engage in these topic areas as students are being trained up. I also wanted to highlight one other thing, and then hand back over to you, Dr. Gibbs. The key to one of our huge competitive advantages is also in the reality that nations are going to pursue what they view as their own best interests. That's just the reality of the way the world works. One of the advantages that we have is oftentimes what's in our best interests as a country is in a lot of other nations' best interests as well. In the sense that democracies tend to share these same kinds of values, they tend to see the value of these kinds of things. And that's another, I think, important competitive advantage that we have vis-a-vis China. If you look at the track record of where China's coordinated with others, you're hard pressed to find times when China's doing something on the international realm that isn't directly related back to China's own self-interests. And that's to be expected. But the problem that China runs into is how frequently divergent what's in China's best interests is from a lot of the other countries in the world. And that's another area that we have a lot of strength, because often what's in our best interests also happens to be beneficial for a lot of our partners and allies. And that's another third source of strength there. Sorry about that.
Excellent.
Yeah,
Rosemary, did you have a final thought before
Yeah,
we move to our Q&A?
Yeah, real quick, the Hastings Center is a bioethics institute. And I'm reminded, Ed, what you were saying about we need to bring the ethical dimension. I'm sure you remember, many here will remember when we were first sequencing the human genome, there was the ELSI project that looked at the economic, legal, and ethical implications of sequencing the human genome. And that was funded by the NIH. And that's sort of ethical dimension and legal and social seems to have been sort of shunted aside as things have, in my view, have gone more commercial. But we need, again, another structure, a place to have these critical conversations about the bioeconomy and where things can go right. And frankly, I think we have to be honest about where this technology, this phone, could go completely wrong. And you pointed that out. And we need a safe space, talk about safe spaces, to be able to have these really tough conversations so we can have a balanced conversation about the risks and benefits and walk that very narrow line for the benefit of humanity. So thank you. I want to thank both of you. You guys have really articulated some very, very powerful statements.
I want to thank the panelists before we go to our Q&A session. I really enjoyed the discussion. And when we did it live, instead of like when we did in the initial rehearsal, no one was talking over each other. So this went well. So as we move into the question and answer session, I'd like to remind everyone that this panel is sponsored by the Scowcroft Institute of International Affairs here at the Bush School at Texas A&M University. So I think the honor of the first question here in our Q&A session should go to the director of the Scowcroft Institute of International Affairs. So with that, I do believe that Andrew Natsios has a question for us, and I'd just like to open it up and see if he'd like to join us and ask his question.
Thank you, Dean, for your comments and moderating the panel. I just actually want to make a couple of comments and then put this out there. There's been a lot of talk about, in both political parties, of bringing manufacturing back to the United States. We have to be a little careful about that, because that's what protectionism is. Protectionism from an economic standpoint does not work. It's been a failure. It is one of the reasons that the Great Depression lasted as long as it did. And in some respects, it contributed to the roots of World War II. Protectionism actually shut off Japanese exports. Japan made a decision to build an empire because Japan couldn't get its exports to Australia, Canada, or the United States. And that led to hunger, actually, in Japan. Japan had a hunger problem in the 1930s. Anyway, we should be a little careful about that. The second point, I completely agree with Will with respect to immigration. We have been a beacon. My family immigrated here 120, 110 years ago. And I might add, it's not just the best and the brightest. My grandfather was illiterate in Greek and in English. He worked in a mill for $9 a week, mills that don't exist anymore. So we've got to be a little careful about saying only we want smart people. We want people who are hardworking and who adopt the American culture. But, you know, Steve Jobs, where would we be without Apple? I mean, a lot of the technological innovations come out of Apple. Steve Jobs' father is a Syrian Muslim, biological father. His father is still alive. He owns a casino, actually. He's quite wealthy in St. Louis, in Las Vegas. So we got to be careful also about making comments about people from different religious traditions. No Steve Jobs, no Apple. The other comment I want to make is globalization is here to stay. If we start saying we're going to manufacture everything domestically in the United States, we will collapse the global trading order. We're not going to be able to do that anyway. We'll simply be excluded. And that's why the Europeans are very resistant to this. The point I wanted to make by putting this panel there is this should be, the biosecurity area ought to be on the same par as weapons developed by the Defense Department for our national security reasons. We do not outsource to other countries the development of our weapon systems for obvious reasons. That would damage severely our capacity to defend ourselves in the event of a war. It seems to me that what COVID-19 has shown us is that we are now dangerously dependent. And I might add, it's not just us, as Rosemary has brought out, it's the whole world. But this is even more serious than this. She did not say this, but we tried to count all the pharmaceutical companies in the greater Wuhan area. That is one of the clusters of biosecurity and biotechnology in China. It's also the cluster of the center of the epidemic. Those factories shut down, not just for us, but for the Chinese, those pharmaceutical companies. And FDA announced 23 different drugs last, I think it was April or May, are now, there are shortages in the United States. So we have a serious problem that we need to correct with respect to the dangerous concentration, even from a Chinese perspective, of a huge number of these plants in one geographic area within one country. That's, I mean, the Chinese ought to be considering decentralizing this for their own purposes. I think this has shown the weakness of the American system and the fact that we've ignored this outsourcing of pharmaceuticals, which seems to me a national security issue. So I think we need to distinguish between those elements of manufacturing that are critical to the security and health of the American people, the survival of the American people in a crisis like this particularly. We should bring those back, and we should do it through an incentive structure. I might add, if you read Douglas North's work about economic growth, he says in it, China will eventually hit, he died some years ago, but he won the Nobel Prize for creating institutional economics. He said the Chinese are going to hit a stone wall. You cannot run a highly complex, and the bioeconomy is highly complex centrally. You cannot do it successfully with high levels of productivity. You need to decentralize everything for decisions to be, that's the beauty of the American system. And I agree with Will, we cannot damage that system. Having all the winners and choosers chosen in Washington is dangerous. So we've got to somehow, and Rosemary said this, we need a public-private alliance between the federal government and private industry to deal with biosecurity issues and economy issues to protect the American people, but also to ensure the integrity of the free market in the United States, particularly around these issues. I just wanted to add those comments in and get your comments of the three panelists.
I don't see anyone muting. Rosemary, should I?
Yeah, sure. Well, thank you so much, Andrew, for those comments. And you're right, we can't make everything here, and I don't think anyone's talking about that. What I'm hearing from companies is it's not a matter of government fiat, but their own decision making for their risk mitigation purposes and their own security, that a number of them are looking to reshore production here for a variety of reasons. They're seeing labor cost differential is not as meaningful as it once was. I also think we have to underscore, China's change in its own security laws. Basically, if you're operating a business in China, any information system that you have over there can be accessed by the Chinese government. It's come out and effectively said that. And there are social credit scores now for businesses operating in China. So if you're an American business operating in China, you will have a social credit score for how well you are serving China's interest. And that presents real challenges if companies are there producing product that are essential for life here in the United States, like PPE. Your first allegiance in an emergency would be to supply your product meant for the US or elsewhere to serve the Chinese people, which is understandable. But I think we have to look out for our interests. So I think it's a balanced approach. I think maybe we've gone too far one way. And for those products that are strategic assets, I really appreciate your perspective about public-private partnerships and what we can do here. And we shouldn't be picking winners and losers, but we do need to find some common ground, because the government needs the private sector, and the private sector needs government to help us achieve the aims for a secure economy and secure country. So thank you.
Excellent. Ed, I think you had something you wanted to add in as well.
Sure. Well, first, I had to riff off of the immigrant aspect of it as well too. So, being a second generation Korean American, my folks, when they first immigrated to the U.S., they were hoping for a doctor. They ended up with a special agent in biosecurity. I think I overwhelmingly disappointed them. I think we're still talking though. But I'm just saying this is the opportunity is just awesome here, and I want to make sure that's acknowledged. But there's another, for Professor Antidepressants, I agree everything that he just mentioned, but there's one aspect that I think we need to articulate here too. It sets it apart from the bioeconomy standpoint. When we say bring manufacturing back, it doesn't necessarily mean bringing the traditional capacity back. It goes back to, we are not positioned to do a technological assessment on seeing where we could potentially be really hurt. Hence the China RX issue. But also, we're not looking at being able to identify what the opportunities might be. So bringing manufacturing might also mean that, what if the future biofoundries are built in Middle America, where we have the highest concentration of biomass? How do we leverage that and turn that into new business opportunities, new job opportunities? So it's not just bi-coastal in concentration and technology and opportunities, but it was also looking at the more agriculturally centric parts of America. How do we leverage that? How do we open that up for innovation as well, where the opportunities may not have existed before? Bio opens the door for that. And I'll put them on the spot, but you have Dr. Douglas Friedman talking in the next panel, but it really showcases that opportunity. Real good, important case in point. There was a story in the Atlantic, I think it was last month, highlighting a really critical vulnerability in the vaccine supply chain from the soap bark tree, right? It's a tree that provides components as an adjuvant for our vaccines. Well, you know what? We could probably SynBio our way out of that, right? And so if you can then engineer, microbe that can make the precursors for saponins, and that's easy. That makes it easier to scale up. That's just one example of how we can leverage our core capacity, talent, our own biomaterial to address a potential key critical supply component. There are many others like that. It's also looking at how do we bring in foreign talent as well, and help them understand that they can bring these key capabilities, approaches back to their own home countries as well too. I'm not looking at it as a binary or a zero-sum aspect of bioeconomy. It's just looking at how do we ensure not just the security side, which is, as a law enforcement perspective, that's what my focus is on, but the aspect of also too is national security is we have to be able to continue to innovate. It's not just getting back what we lost, but it really has to be about how do we set ourselves up to run faster. And it's not just about the U.S. It's yes, we bring back some of the manufacturing capacity, but it's also being able to empower our key partners, as well as going towards a long way towards coalition building. And how do we shore up their ability to succeed in the future bioeconomy space too? But those are all going to be aspects and talking points from a strategic standpoint that encompasses not only domestic policy, but economic policy, foreign policy, national security policy. And again, the bioeconomy kind of serves the context to bring that all together and look at it in a holistic manner. Because right now, again, this kind of goes back to the prior comment, for the incoming administration, what's the recommendation? This is a big one. The bioeconomy, again, shows cases that we need to bring all those aspects, perspectives together to look at these things more holistically, not just for the security components, but absolutely looking at the potential greenfield opportunities that we have to address and start moving towards.
William, did you have a comment before Lauren gives us our next question?
Sure. Yeah. So the first one, just kind of building off what Ed's talking about, what Rosemary mentioned earlier. When you think about innovation, most of these scholars that look at innovation think about two very different kinds of innovation. So one is what's talked about as like in-process innovation, or that evolutionary innovation, where by manufacturing something, you could take those marginal incremental improvements and innovate and take cost out of the supply chain. You can take processes that get improved at the margin. And so there's like a certain evolutionary component to the innovation that happens when you own the manufacturing side. And we're okay at that in the United States, but we're probably not the best in the world at that. China arguably maybe is the best in the world at that in terms of squeezing out every marginal little cost. You can see this in stuff you order on Amazon sometimes. You get something that's produced in China, and like, you know what, do you need this whole thing to be made out of metal? Let's carve out the middle here, and that middle chunk is no longer there. And so they've saved that marginal cost in the production of that good for some quality trade-off. And they've run the numbers and said, it's worth the trade-off. It's going to rust out in 2 years, but it costs 10% less. So that's the kind of thing that I don't think we're super good at naturally in the United States, although there's something to be said for this. But the thing where we really are world class is in what's referred to as like revolutionary innovation, or completely game-changing, path-breaking innovation. And these are areas where, as Ed talks about, you never saw that coming. And it turns out like, whoa, that just changes everything. The whole basis of the industry that used to compete on these metrics is no longer relevant because there's a completely new way of doing something. And guess who invented that new way of doing something? That's the area where the United States' innovation machine is really stupendous. And it's the area that China struggles most with, ironically. So when you talk about that incoming administration, where do you put your chips down? I would say you got to make sure we can still hit those home runs. That's the thing that a lot of other places find it to be very difficult to do, that sort of revolutionary path-breaking innovation. The second one is, I think, in light of where we want to go and what we want to think about in terms of the game plan and the strategy, this is a highly uncertain outset of this competition and this marathon. And in that regard, I think it's important to maintain flexibility and the ability to have a relatively decentralized, and dare I say, even have a couple of different options going, because you're not quite sure at this stage what is going to be the optimal design, or what's the optimal process, or what's the optimal model. So there's a trade-off here, because you have too many of these things going on and it's a cacophony and there's no strategy and there's no coordination. But there's also a trade-off. I think this is what Andrew was talking about as well. If you zone in and say, this is our game plan, we're locked in, we're sticking to this, you might have picked the wrong one potentially. And I think it's important to have a little bit of humility at this stage of the game to recognize that we want to design a system that has a dynamic capability of adjusting. And because I think we are in a very uncertain moment in this overall competition, the overall evolution of this. And so I think we've got informed, smart people that could tell us where you probably want to be having a dog in the fight. But I think it's also important to be careful not to get overly locked in and to maintain that flexibility and the ability to go back and reevaluate and say, is this working? Is this particular private partnership working? Is it generating the results? Should we do more of these? Should we do less of these? And in that sense, that decentralized approach, I think, is exactly the right kind of approach to provide that flexibility and that ability to adjust on the fly as conditions warrant. Lastly, on the intelligence of immigrants, I agree, Andrew. Not all immigrants. My own family's immigrants. They were not the brightest bulbs in the shop, but they do tend to be. My point is that these are unique kinds of human beings that are either hardworking or risk-taking or really have a high potential that can't succeed where they're coming from. And I don't particularly care which combination of those three elements you want to emphasize. What matters is that often these things coalesce in these individuals who take the chance and roll the dice to come to this nation. I think that's the important thing. That's the important insight. That's it. Over.
Excellent. Lauren, would you like to introduce the next member of our audience with a question?
Yes, so we have Robert McCrate, who is a lecturer at National Defense University, with the first question.
Yes. Hello, Ed. Good to see you. I have a question for you and for Mr. Norris. It's sort of a split between the two of you. Just as sure as the U.S. loves poker and China loves Go, we have different cultural approaches to things, in the way we game, the way we think. But my question for you, Ed, and for Mr. Norris is, given that you and I have talked before about China cornering the genomic code and the DNA gamble that they're taking, I wondered if you could comment where you see that going, just going out 2 or 3 years. And I'm specifically wanting to pursue the question of nanogenomic engineering as a place where we're not and they are. And along with that, in line with the current discussion, it makes me kick myself because years ago, when I tried to work on something called the National Bioforensic Strategy, as you know about, Ed, we still don't have what I think we should have, a Class A game there. And if we had one, we'd have been able to unravel this COVID-19 problem rather than have this mixture among medical professionals about where this came from and how it started. So the question for you and Mr. Norris is, in those two areas, do we really understand the game that China's playing? And do we understand the strategic significance of nanogenomic engineering, and the fact that we're disadvantaged because we don't seem to have a forensic strategy of our own for any pandemic? That's it.
And it looks like you're primed and ready to go, and then we'll let William back you up there.
Sure. So I'll just focus on the technical. So if you think about the latest and greatest of genetic technologies, right? We're in the age of CRISPR, right? Doctors Doudna and Charpentier won the Nobel Prize just last month for discovery of CRISPR. But if you think about those technologies and CAR-T therapies, for example, is going to be a big wave. Genetic-based therapeutics, at the end of the day, they're built on data, right? If you want those tools to work more with higher efficacy, with more efficiency, with more confidence, you need access to more genetic information at a population scale. So to that end, that would potentially translate into a significant advantage to, in China's favor, because of the fact that they are an authoritarian regime. They have the complete ability to aggregate individual genetic information without consideration of privacy or patient data protection or sovereignty. That has to be taken into account. So a couple of years from now, 3 years from now, they may really, kind of goes back to my nightmare scenario. It's not about engineering a virus that causes zombie apocalypse. The nightmare scenario is that because of our lack of understanding and appreciation of the value of our health data, might translate into us becoming inadvertently healthcare crack addicts, and then becoming our healthcare butcher, because that becomes their dominant, one of their dominant exports is affordable precision healthcare. To couple that with what's already happening with us with the China RX scenario would be a very melancholy situation. But the juxtapose of that is that at the end of the day, it's still our data. We still have that data, but we just haven't set up the infrastructure to be able to leverage it, because looking at our electronic health record system, our ability to share and transport data, that already has been an existing problem in delivering effective patient healthcare delivery in our own country. But then taking it to the next level, what are we doing to set ourselves up to be able to take advantage of that, to be able to accelerate our innovation while at the same time, respecting individuals' data privacy and data sovereignty? It's looking at it from that security innovation balance that I keep referencing, but that's a very practical application, one scenario that we need to start looking at as far as, what can you do with genetic information? And then finally, the one element that, it may not go over so well with the folks that are online, but those very same experts that I mentioned that I brought in those various workshops, one of their findings was that, privacy is dead. There really is no such thing as privacy in this new day and age. What we really need to start thinking about is security. And that's looking at how do we secure our own individual data? How do we provide patients better informed consent? How do we provide consumers better education and a better buyer beware as to the value of their data and what the consequences might be if that data is lost or co-opted by somebody? And it's looking at how do we leverage that aspect as well. And so it's not just the forensic analysis aspect of it, but it's even before the data gets out, how do we set ourselves up to better protect ourselves, but then also put ourselves in a situation, and this is kind of riffing off of Professor Natsios's aspect too. We just can't put complete walls, whether physical or digital, around our data, because then we might marginalize our ability to capitalize on the benefits. It's what are we doing at the same time concurrently to address security while at the same time being able to reap the benefits. But that does take a new paradigm and how we look at the bioeconomy and how it translates into security. So I hope that helps.
It does, Ed. And regarding viruses starting the zombie apocalypse, you never know about that until 28 days later, or maybe 28 weeks later. So William, your comments?
Yeah, I think, thank you, Mr. McCrane. I think that whether or not we understand China, the short answer is no. I think that there are some people in some aspects of our society who do focus specifically on China, but for the most part, so far right now, we're at that stage of our interactions where it's still left to experts. It's a purview of expertise. It's not broadly understood or broadly well known in society or across society. It's not well known across industry unless you happen to be a company that does a lot of work in China. For the most part, most CEOs have a relatively thin understanding of the other side of China. It's not even well understood even within the academy, unless you happen to be coming originally from China, and so you know it because you grew up there and now you're a member of the US Academy, or if you happen to do work that focuses on China. So it's still relegated to the realm of expertise. And early on in my career, I had a mentor who had a very prescient perspective on this. And he said that during the course of my lifetime as a China expert, it'll be broadly understood that China will have become far too important to be left to the China experts. And so I think recognizing that reality, I think it's incumbent upon us in our system to get a lot smarter about China and understand China a little bit better. Even if that's not the case today, I think that's one of the areas that we do need to work on. Over.
William, I love that statement. I always say, I think one of the most powerful things you can say is, I don't know, or we don't know, but we'll try to find out. So Lauren, I believe we've got time for one more question before we move to the next panel.
Yes, and it's going to be from Miss Lisa Roberts Helton.
Lisa, I believe you're still muted. Right,
My
Lisa,
question was,
oh, there you are. Okay.
okay. What can we do as just a regular U.S. citizen to help with these issues? And Ed, you kind of touched on that. And then what can we do to help protect ourselves against biotechnology and tainted drugs?
So how about we go to Rosemary first?
First of all, thank you for the question. I think the first place to start for a consumer, what I do, fortunately, I don't take too many prescription drugs, in fact, none, but even over-the-counter products, I will call up the manufacturer and ask them where it's made and the finished product as well as the core ingredients. And some will tell you, which to me is a good step forward with their transparency. I would also suggest looking at a website that's sponsored by the National Library of Medicine, which is part of NIH. The website is Daily Med, M-E-D. And if you have in the search bar, type in the drug that you're taking. And then you can search to see all the different registered producers of that particular medicine. And there are pictures of labels on them for each product. And you can click on the label and it will tell you either made by, distributed by. And I would just call up the distributor or manufacturer and ask them. And this is a third point I make, and this is not an advertisement at all, but typically branded products, a company that is a known name has their name on the bottle and on the box. And so there could be more care taken in the production of that product. Finally, I really appreciate, and I have no financial ties to this group, but there's the online pharmacy I mentioned earlier called Valisure. They're on the campus of the Science Park affiliated with Yale University. And they are the only pharmacy that tests every batch of product before it sells it. That should be standard practice. I hope it becomes that. It's a great step forward, and they find huge variation in the amount of active ingredients. They're the ones that found the carcinogens in metformin. They're the ones that found the solvents in some blood pressure medicines, more carcinogens. So they test everything. Now, that's a great start, but they can't test for everything, but they're trying. So I think we need more companies out there that say we test everything, and that will give more confidence. And I encourage people to explore those options.
Ed?
We have to send a signal to the marketplace as consumers that this is what we demand, that the status quo is just outrageously unacceptable. And I say this when I do grand rounds at major hospitals, I say it very nicely and politely, but why do you tolerate a supply chain that supplies you with substandard, in some cases, lethal products that are in persistent shortage? Why do you tolerate it? And so we have to then use our purchasing power to buy differently and send a signal in the marketplace that we stand for high quality, and high quality does not have to cost that much more. It can cost even less, and certainly in the long run in the bigger picture. So I hope that answers your question. I wish you luck, and you can please email me offline and I'll be happy to talk with you more, maybe walk you through the Daily Med website.
Ed, I can tell you've got a comment you'd like to riff off of there.
Oh, I was just going to say what she said. No, but I
Great
mean,
minds.
yeah, but you're precisely doing what needs to be done. You're asking questions, right? So if we've done our job right, it's about getting awareness out there. And as all of us as individuals, we are now educated and empowered. Start asking those probing questions, those second, third order questions, and may be as fundamental as, hey, as we start storing more health-related data on our phones, take a look at the apps that you want, those fitness or health apps. What permissions are you actually allowing to access your data and where it might be going? And asking those questions, before you send off that saliva sample to find out, I want to find out what percentage ethnicity I am. Ask those questions. It's your data. Where is it going? How's it going to be stored? How's it going to be utilized? But most importantly, who's going to have access to it? So it's just getting that awareness out there as quickly as possible. Yes, we need to do a better job from a policy standpoint to push that out. But I know as a final statement, thank you so much again to Texas A&M and the Bush School and the Scowcroft Institute for setting this panel up to kind of put that awareness out there, because this is a significant step in the right direction, and we absolutely need more of it.
William, would you like a final word before I close out?
No, I want to make sure we stay on time, so I'll hand it back over to you, Dr. Gibbs.
All right, thank you. So I would just ask all of our attendees if we could give our panelists just a round of applause here. Thank you to Rosemary Gibson, Senior Advisors, the Hastings Centers. Thank you to Dr. William Morris, Associate Professor at the Bush School, And thank you to Ed Yu, Senior Fellow of the Scowcroft Institute and Special Agent with the FBI. I'm Sean Gibbs, you're the Dean here at the School of Public Health, and this has been the Bioeconomy and Overview as part of the 6th Annual Pandemic Policy Summit here at the Scowcroft Institute of International Affairs. And with that, Lauren, I'll turn it over to you.
Thank you, Dr. Gibbs. We are going to take a short break in case anyone needs to take care of anything real quick, and we are going to start panel 2 at 10:40. So let's meet back then. Thank you. And we are ready when you are, Dr. Lane.
Very good. So welcome everyone to panel 2 of the 6th Annual Pandemic Policy Summit. Our topic is technology, potential and challenges. I can tell you from doing some of these sorts of things in days gone by that the potential tends to be the positives and the challenges tend to be the negatives. And for some reason, everyone leans toward wanting to talk about the challenges more. And we're going to try not to let that happen if we can possibly keep from doing so. So let me give a couple of quick introductions. I'm Glenn Lane. I'm a Regents Professor, Vice President for Research Emeritus. You get an emeritus title when you've been around almost too long, I think. I'm a director of the Michael E. DeBakey Institute for Comparative Cardiovascular Science and Biomedical Devices here at A&M. And so even though I've been in cardiovascular medicine for some years now, I started life as a microbiologist and have a particular impact over time or interest over time on the impact of infectious agents on a unit's ability to function. And the unit could be a military unit, a business unit, whatever. And so looking into, which infectious agents, percent infections, has anybody been immunized? Are there any treatments? I think the military tends to call this conserving the fighting strength. So I guess that's why I'm the one to talk about this particular panel. So Dr. Gigi Granval is a senior scholar at the Johns Hopkins Center for Health Security and an associate professor in the Department of Environmental Health and Engineering at Johns Hopkins Bloomberg School of Public Health. She has written about the scientific response to the COVID-19 pandemic and implications for national and international security. I'll give a couple of positive comments here about Dr. Granval is the author of Synthetic Biology, Safety, Security, and the Promise, and also of Preparing for Bioterrorism, Leadership in Biosecurity. I don't know if she's selling books, but there you have it. One more comment there that she's a member of the Threat Reduction Advisory Committee, which provides the Secretary of Defense with independent advice and recommendations on reducing the risk to the United States, its military forces, its allies and partners posed by nuclear, biological, chemical, and conventional threats. Doug Friedman is the Executive Director of the Engineering Biology Research Consortium and holds a concurrent appointment as a principal investigator at the University of California, Berkeley. His technical interests lie in the fields of synthetic biology, biotechnology, physical organic chemistry. Doug's interests include governance of biotechnology, safeguarding the bioeconomy, and accelerating scientific advancement by building diverse, robust community partnerships. Doug was director and senior program officer with the Board on Chemical Sciences and Technology at the National Academies of Sciences, Engineering, and Medicine. And he directed several major studies at the National Academies. And Dr. Gerald Epstein, he joined the National Defense University Center for the Study of Weapons of Mass Destruction in 2018 as a distinguished research fellow. He works at the intersection of science, technology, and security policy, particularly concerning the governance and security implications of advanced life sciences, biotechnologies, and other emerging and converging technology. He was Assistant Director for Biosecurity and Emerging Technologies at the White House Office of Science and Technology, where he was actually on detail from his position as Deputy Assistant Secretary for Chemical, Biological, Radiological, and Nuclear Policy at the Department of Homeland Security. So for anyone who is into these sorts of presentations, you'll recognize that this is a particularly distinguished panel. So a few operational details. Each panelist is going to be given about 10 or so minutes to give a bit of an introduction. Then we'll have an open discussion with them for roughly half an hour, and a half an hour question session. If you can send questions to Lauren via chat, she'll get your name and affiliation if you have one, and then we'll be able to open your mic. So as we enter the discussion, I can tell you that the whole bioeconomy deal has been an eye-opener for me, and without beating any of the details to death, I'm just going to recommend two reads. And one of the ones has already been put forward on chat by Ed Yu, which is the National Academy Report, Safeguarding the Bioeconomy 2020, which Jerry Epstein happens to be a contributor. And even though the document itself is 300 pages long, there's an excellent executive summary if you want to go ahead and take a look at that as a follow-up read. And also the Scowcroft Institute has been doing these annual pandemic presentations for some time. And if you go to their webpage here at Texas A&M University, Scowcroft Institute of International Affairs, Pandemic and Biosecurity Policy, there's a series of white papers that could be insightful without having to go into their details. Those are two reads. Okay, so we're actually going to go with Doug Friedman first, and I'll tell you why. He sent me a note saying that he wanted to play the role of techno-optimist on the panel. And so, as I said earlier, I think that is not a bad place to start. So Doug, we're going to give you your 10 minutes and go for it.
Thanks so much for that introduction, and it's great to be with you today. I'm actually going to adjust my remarks a little bit on the fly, having just listened to the first 90-minute panel. And so bear with me as I try to do that with you. So as introduced, my name is Doug Friedman. I'm the executive director of something called the Engineering Biology Research Consortium, which in fact is a public-private partnership focused on advancing engineering biology here in the US. And public-private partnerships came up a lot in the last panel. And so I wanted to just take a minute to talk a little bit about what my organization does and how we do it, as maybe a lead into some of the broader discussion to try to draw sort of connections between the two. And then I'm sure Dr. Granval and Dr. Epstein will add a lot of commentary to that here. So we exist at the interface of academia, industry, and government, and understand this idea that these three sectors all have an important role to play in advancing science and technology in the US. And by coordination and communication between these three, we can move faster, do better than we otherwise would. And that includes really all areas of science and engineering. But what we're interested in, of course, as in the name, is engineering biology. We do this by really thinking about what is the 20-year future, the technical future of the field, and developing technical research roadmaps that are focused on early R&D priorities to advance this field. And it covers everything from health and medicine to industrial biotech to environmental biotech and energy. And we do this with this mindset of saying, what are topics and opportunities for academia to work on that really are relevant to industry and commercialization, and that the US government can pay for, basically, right, with their investments in early R&D. And with all of that in mind, some communication at the outset can really advance the field in some fundamental ways. And what we've done is we've published last year, now almost 18 months ago, a very long 52,000 word research roadmap on engineering biology that goes into excruciating detail about R&D priorities that we could focus on that will tie into commercial opportunities. And I bring this up because of the comments earlier about public-private partnerships, because I run one, I really believe in them, but I do think that there's a lot of opportunity to think about how these work here in the US in a way that fits in with our system, our economy, our mode of economic development to be quite productive. I'll also mention that EBRC has just started a new public-private partnership called Biomade, which is a new manufacturing innovation institute focused on industrial biotechnology. And if there's time later, we can talk more about the opportunities that are there. But getting into what I was supposed to talk about today in my techno-optimist role here is to reinforce comments from before that innovation will be critical to our success. And we often think about both opportunities and challenges, but the way I think about challenges is I think about what opportunities will bioinnovation provide to mitigate those challenges. Whether we're talking about a pandemic that we're currently in, other public health emergencies, or a lot of potential challenges associated with advances in biology and biotechnology, a lot of the solutions to those challenges will also come from biology. And biology isn't going to stop, right? This R&D effort isn't going to slow down. The world is advancing this quickly. We heard a lot about China in the first panel, having a strategic national strategy around advancing biology and biotechnology. So we really have one choice, and that choice is to innovate, understand these systems, stay ahead of these systems. And if we're doing it right, many of those challenges will get reduced by us being able to both understand these systems as well as innovate our way out of any problems that may arise. The second point I want to make is that, and it may be obvious to many of you, biology is not just biomedical. It's not just about health applications. When I mentioned EBRC's roadmaps that we've put together, I included energy, I included environmental biotech, I included industrial biotech. And we really see the opportunity for biology and biotechnology to impact all sectors of the economy. Jerry's going to talk about the Safeguarding the Bioeconomy National Academy study, which does a great job of talking about the scope of the bioeconomy and biotechnology. But I just want to give really two examples that I particularly like about how we can think about biology in a way that's fundamentally different from the biomedical focus, and then maybe give one quick COVID example before turning it back to the moderator. And so I live in California, and we're fortunate now that we've hit December in California, where wildfire season has subsided. But Every year we have worse and worse wildfires, especially in Northern California now where I live. And these fires burn down a lot of homes. Biotechnology is a real opportunity here because there's a species of tree called ironwood that is naturally fire resistant, but its properties make it such that you can't create lumber very easily. Now, with biotechnology, you can imagine manipulating these trees to introduce properties that make it more like lumber, but maintaining some of the fire-resistant properties that come naturally from this ironwood. And if that's the type of lumber we're using to build homes and businesses and structures here in California, we're naturally building in fire resistance to a problem that we know is going to be increasing. And these are examples of biotechnology that I think are really powerful that we can bring to the fore to advance this area and have a lot of positive environmental consequences. The second example comes from something that was mentioned earlier, and that's about supply chain resilience and really is focused around industrial biotechnology. In the US, we have a real opportunity where our country was essentially made to be an industrial biotech powerhouse. We grow a lot of crops that can be used effectively as feedstocks for industrial biotech applications, from corn and corn stover in the Midwest, to sugar beets in Michigan, to switchgrass sort of in Virginia and South, to even almond shells in the Central Valley of California. All of these you can imagine entering an industrial ecosystem where if we had industrial biomanufacturing facilities distributed across the US, and we heard earlier from the director of the Scowcroft Center about why distributed matters, we can really think about how we can be making and manufacturing raw materials in a robust and diverse way here in the US, and in a way that allows us to pivot to respond to national emergencies, which gets me to my last COVID-related example. One of the issues that came up, and I think it was Rosemary that mentioned suits and masks and how raw material supply chains were really a problem for generating these materials. This in the US was a result of the fact that the raw chemical materials that we have domestically supplied are tied directly to the oil markets. That is, the raw materials, the raw commodity chemicals come from byproducts of petroleum manufacturing that are only responsive to supply-demand signals related to fuel. No one was moving around, the fuel markets tanked, therefore there were no raw materials to go into suits and masks. Now, if we had this distributed bioeconomy focused on biomanufacturing, we can pivot chemical production and say, okay, well, now it is responsive to these demand signals that we see and are able to supply companies like DuPont the raw materials they need to make Tyvek suits that medical workers need in a more coordinated and robust and responsive economy and ecosystem. So I've played my role as techno-optimist. Thanks for the opportunity to be here. I look forward to questions, and back to you.
Great, thank you very much. So I'll say that we spoke earlier among ourselves and we decided to use first names. So I'm not being disrespectful if you hear me doing that. So Gigi, would you like to give your first?
Absolutely. Thank you. Thank you for the introduction. And it's fine to call me Gigi. That's fine. So I'm going to talk about a case study that we did that's important to the U.S. bioeconomy in recruiting and training our future workforce. So one time-honored way that people seed the pipeline for the future workforce is to have high school and college competitions. There are dozens of US-only global competitions in robotics, computer science, and they're sponsored by not only the US government, NSF, but by Google and Intel. And these competitions can be, can be fun. There are movies about them, but they're also prestigious, and students want them to be on their resumes. By contrast, there are just not that many bio competitions. And I can only think of really two. There's one kind of small one called the Biodesign Challenge, which is New York based, and it's super cool. I really highly recommend that you check it out. It's a college class that students take over the course of a semester, and they come up with a project. It's very futuristic, and it's much more artistic and fashion oriented, and it's very interesting. But the big one, kind of the flagship for competitions, is the iGEM competition. That's the International Genetically Engineered Machine Competition. And that began also as a class at MIT in 2004. And it has grown since to be more than 350 teams competing from 40 countries. This is 2019 numbers, and there are approximately 40,000 alumni of the competition by now. So it's mostly college students, but there are some what they call overgrad, and some high school teams as well. And so they are all given access to standardized parts, kind of like the robotics competitions, and they have a defined period, about 5 months, to solve a biotechnology problem of their own choosing. And they all come together at this big competition called the Giant Jamboree. It's a 5-day event that's been held in Cambridge. It's been virtual this year, but they're scored by judges. It's really kind of, they try to replicate kind of a sports environment. The teams have their t-shirts. It's really inspirational. And I mean, these students are so excited to be there. They learn a lot from each other, and they also get prizes for fulfilling their goals, not just competing against the other teams, although there is that too. So if participation in iGEM, it's been kind of a symbol of excellence that the National Academies has used, that other groups have used to say, like, how much of a country, how well a country has done in iGEM, and how well a university has done. People use it kind of as a shorthand metric for all of these things, capabilities in synthetic biology. So if that is the case, and if you do use it as a metric, the trends are not great for the US. Only 58 or 17% of 339 participating teams in the 2019 competition were from the United States. 104 or 31% were from China, and 81, 24% were from Europe. So a lot of why we did this little case, we interviewed 10 coaches in the US to kind of assess what some of their challenges were and what they saw when they went to competitions, looking at the other teams and how well supported they were. So we interviewed 10 coaches from a variety of places, community labs, public, private universities, and military academies, just to get their opinions. We were motivated to do this because iGEM announced that after years of being held in Cambridge, they are planning to move the competition to Paris. And so that is going to be, a huge additional expense to these teams. And so we were just curious what the coaches thought about that and what kind of support or whether they would be able to participate. And then there's this rumor that that after Paris for a couple of years, there might be another move of the competition to go to China. And that is an unconfirmed rumor, but just so you know that was part of what motivated us to do this. So we talked. So something you should know, that these teams, it costs quite a bit of money for them to participate. It costs $5,500 just to register your team. And then going to the Jamboree in Cambridge, it's a 5-day event, travel, room, board for your team of 8 to 10 to 15 students, that really adds up. But you know, that has not prevented teams from around the world from participating. There's a lot of, I have in the paper that we published about this, I have some great quotes if you need them, where people are decrying how, you know, they're not sure that their teams are going to participate. One coach we spoke to talked about how they had food insecurity issues in their team, never mind trying to find funding. A lot of the teams right now in the US, their time is spent raising money to just go to Boston. They hold bake sales and car washes, and they are scrounging for equipment and writing, you know, instead of actually doing the science. So grant making is a very important skill in academia and for future scientists. So it's not that scrounging for money is not something that they should learn how to do. But one of our recommendations from this is to create some sort of granting mechanism so that the teams can write and apply for money. And if you don't want to just give it to them, which is another thing that other nations in the world do for their teams, is they actually give them the money for supplies and for laboratory space, and to have paid mentorship. A lot of the teams in other parts of the world, especially China, they have people who help the students with their projects and keep them, you know, keep them safe and learning. And so you could argue whether or not that's a thumb on the scale, and so a lot of people in the US have said that. But you know, it's hard to get people to volunteer their time, and so the coaches that we spoke to give enormous amounts of their free time to their teams, and it would be nice to have that compensated and rewarded, because you know, postdocs may be looking for educational opportunities, something to put on their CVs as well, that they were a mentor to a team. But I think, you know, having a fellowship where a postdoc could get that and have responsibilities would be a fantastic idea. So the other recommendation that we have after talking to these coaches is that the US should really explore some other ways to have competitions for biology. I know that there are people who are very devoted to iGEM and would like to see all of our focus be on getting more US teams there. And I think that is a good idea. But you know, engineering has a bunch of competitions, and some of them are pretty amazing, and some of them are, you know, more small scale and just more regional. And I think that there's room in biology, if the science of the next century, to have more than a couple of competitions to provide experiential learning to students, because this kind of learning is really important for them to do well through their school, but then also to be entrepreneurs and to start companies and to create jobs. And that is something that iGEM has, you can credit iGEM for doing. So they have had some pretty big successes in companies that started from this event. People argue whether or not some of the Ginkgo employees were very involved in iGEM early on, and they just received, or they're about to receive, over $1 billion from the U.S. government for COVID testing. So you know, there's a lot of opportunity in providing this kind of education to the U.S. students to really give them a boost in STEM, and so I appreciate the framing of the challenges and opportunities. We have not paid enough attention to our students in this area, and this is an easy opportunity to create more opportunities to learn. So that's it for my remarks, and I look forward to your questions later. Thank you.
Great. Jerry.
Thank you. Let me see if I can work the screen share here and get started. Okay. Thanks. It's a delight to be on share the screen with colleagues on the panel and to be part of the session. I'm going to be talking about the challenges. I am going to be talking largely about the National Academy's the report that's been mentioned, Safeguarding the Bioeconomy. And we were asked to look at what it would take, some of the risks that were posed to the bioeconomy and some of the things it might take to safeguard it. So I'll be drawing my talk from that. Just want to start off with a standard disclaimer, and I'll add one to that. I'm not, of course, representing National Defense University here. And among the institutions I'm not representing, I'll add the National Academies. I am drawing heavily from the report, but I'm not speaking for them in this, and I'll try and point out where I'm added or diverged from the report. So in terms of what the bioeconomy is, we had a great discussion on it earlier this morning. The definition that the Academy's panel was asked to come up with and did said the bioeconomy is economic activity that is driven by research and innovation in the life sciences and biotechnology. That's clear, that makes sense. But we went on to say, and that is enabled by technological advances in engineering and in computing and information sciences. So this gets at the convergence of disciplines. The bioeconomy is much more than bio. It's empowered by its connection with the information and computer sciences. It has reached far beyond the domains that were traditionally thought of as being biological domains, as Doug has mentioned. And we tried to capture the full breadth of that in this study. In terms of looking at, I'm characterizing the risks to the bioeconomy and also risks from the bioeconomy. And I'll try and lay that out here. The Academy sort of put these in a couple of buckets. We talked about one of the risks in the bioeconomy moving ahead is failure to promote it. And this may be what Ed, you had been referring to in terms of the moving faster sets of things. These risks would be failing to provide support to the bioeconomy in ways that are really under our own control. These are things we can do to empower the bioeconomy, and I'll lay out a few of them. There's also a series of risks about failing to protect the bioeconomy from harm. And this harm is not just deliberate harm from those who are adversaries, but competitive harm. We're in a world competitive economy, and we like the bioeconomy to prosper and thrive in that competition. And so here we're worrying about failing to avert harm to the bioeconomy, largely on the basis of things that are not directly in our control. How we respond to them is our control, but the risks themselves are posed by others or by the environment we're living in. And then I've carved out a third category. The National Academy's report did not split these last two apart, about protecting the bioeconomy from misuse. And these are harms not to the bioeconomy, not things that will make it less efficient and less effective, but ways in which society or individuals or institutions might be harmed by abusing elements of the bioeconomy. So we're trying to avert harm that's from the bioeconomy or mediated by it. It's important to recognize the areas in which the bioeconomy itself can be used as a means of damage or attack. In terms of failing to promote the bioeconomy, these are a whole set of things that may fall under innovation policy, the things that we as a government can do to try and make this sector prosper. We can fail to provide, or the things we're not trying to do, are providing insufficient US government R&D investment. We had a fair amount of discussion on that earlier, and I'm sure we'll be talking about that further. Gigi's already referred to the concerns about not having an adequate workforce, both domestically, and the morning panel talked about the importance of being open to international participants in our workforce. We have concerns about having an ineffective or inefficient IP environment. One of the bases of the US innovation system has been its IP environment. There's been some considerable uncertainty in the biotech intellectual property environment, and I was delighted to see tomorrow morning's panel will focus on that topic, so I won't say anything further about that here. We also want to make sure we have an effective and efficient regulatory environment. And this is both in terms of having a regulatory environment that permits innovations to make it through and come out the other end and enter the market. And it's also in terms of having a regulatory environment that the public believes in, that is protecting their health, welfare, and safety and that of the environment. So we need to be able to do both of those things. We also are concerned about asymmetric research constraints. This would refer to rules or restrictions we impose on ourselves in terms of doing certain aspects of research related to the bioeconomy. I might include here, say, the use of stem cell research or research into human reproduction. Certainly a legitimate area for public policy to put constraints on that type of work, but it's one that we should do knowing what effect it might have in the international competitive environment when we're competing against countries that don't make those same choices. And then there's sort of a catch-all category that we could go in a great deal more and further, but in the interest of time, I won't say a lot about. But many aspects of the bioeconomy touch on some of the ethical, societal, and legal implications that were also raised in the first panel. If these proceed in ways that are losing public trust or that are seen to conflict with public values, we are going to have difficulty having the civil society accept them, one thing civil societies can do when they're concerned about activities is go to their lawmakers and have laws to restrict it. And they can also speak through the marketplace. So if the products of the bioeconomy are not reflecting public values, are not seen as things that people want, or seen as somehow threatening the type of society they want to live in, those products will be harder to prosper. And this includes things like the ethics and propriety of modifying human DNA or gene editing of people, which we've seen a lot of controversy about. The distribution of economic benefits between producers and consumers, something that's been characterizing the genetically modified plant debate. The degree to which the risks that are imposed by biotechnology activities are borne by those who are benefiting from those activities, or whether the risks are borne by people who are other than the beneficiaries. So all of these things can lead to conflicts in values. None of them are going to affect the bioeconomy globally, but they could very much affect pieces of the bioeconomy if we're not able to manage and have the discussions and engagement we need to make sure that these activities can proceed in ways the public is comfortable with. In terms of the category of protecting the bioeconomy from harm, we have constrained access to international data, and Ed, you talked a lot about that, but countries who do not permit the export of data from their own countries, but are drawing on the international environment, have a larger pool to innovate from than those countries who are restricted to what they have available or what they can get from those who are sharing and who do not have access to data from countries that don't share. So there's an asymmetry there that can have consequences. One of the important implications are the connections I've mentioned at the outset, that the bioeconomy is a marriage, a convergence of conventional biotech with information technology, machine learning, automation, cyber control, is that all the pathologies of the information sector therefore get imported into the bioeconomy to the extent that the bioeconomy is now depending on the information sector in this way. So we have a whole range of cyber risks, which are really important to take into account. They're not necessarily new, but they may be unfamiliar to people who've been looking more at the wetware and the bio and the laboratory aspects of the bioeconomy without taking consideration of the broader contributions. We've already had a fair amount of discussion of a category of the Academy's report called economic attack, the theft and infiltration of non-public or proprietary data through either employees or cyber espionage or other means, which are ways of taking value created in the US bioeconomy and using it to the advantage of others who are able to steal that illegitimately. Category the Academy is referred to as state involvement in business activities. This can include the subsidization by a country that's putting government money into what other economic systems would say is a private firm area and not legitimately subsidized. And also foreign investment. A considerable amount of attention in the security sector is being given to the investment in the United States by countries who are buying, who we seek to buying high profile or interesting or important emerging firms in this area. And is that a business where the ownership of that firm is thought to confer a security advantage to the country of origin? Oh, I'm sorry if I'm writing on my screen. And then there's trade barriers. The US bioeconomy can suffer if it tries to export into countries that have a different regulatory structure and are not accepting US bioeconomy products, whereas we may be importing products and having a more open regulatory process here. And the question we've seen earlier about forced technology transfer, that this has particularly been raised as a problem with China. Firms setting up business in China and doing work there have been forced to transfer their technology to China, leading to the creation of companies which will then compete against that firm. These are all areas in which the US bioeconomy is vulnerable to harm based on the actions of others. And we need to take account of these and deal with them with the absolutely important proviso that we have to do that in a way that doesn't shoot ourselves in the foot. And I can talk about that later, but we talked earlier that the first panel talked about some of the things that have led to the amazing strength of the US innovation system, and particularly the US innovation system in the bioeconomy, or that the bioeconomy has grown up from. And we do want to make sure we are preserving those strengths and not harming them in the process of dealing with some of these concerns. Then in the category of failing to protect the bioeconomy from misuse, there's the use of data sets which could infringe on individual privacy or could, in the aggregate, could lead to harm to national security. And again, Ed, you talked about that to some extent in the first panel, that if the aggregate, say, genomic heritage of a country is available to adversaries, what might the implications of that be? The bioeconomy, given that breadth, given that, as Doug had said, not just a matter of life sciences, but it's in agriculture, it's in industrial production, it's becoming integrated in what we are now calling critical infrastructures, those infrastructures on which society depends, like the power grid, the communication system, the financial sector. The life sciences or the public health system is certainly a critical infrastructure. The bioeconomy is an important component of that. But as it grows in the economy more broadly, the bioeconomy will be part of other critical infrastructures. And things that can hurt the bioeconomy, here I might call particular attention to the supply chain interruptions we spend a lot of time on this morning. If the bioeconomy is vulnerable to these sorts of harms, that can then impair its ability to help serve in its critical infrastructure role and can have broader consequences in the economy. And then we come down to the traditional biosafety and biosecurity risks. This is an area which these conferences have spent a lot of time on over the years. And I sort of highlight that because that's what collections of people like us tend to want to talk about a lot. But it's a small part, and these still remain very important, but it's a small part of the broader picture that we're trying to paint with the bioeconomy as a whole. A little bit of more detail on some of those risks I pulled out, and then we can turn it back to the panel discussion. In terms of data and cyber risks, the bioeconomy being part of the broader economy is at least as vulnerable to cyber risks as any other sector. So if you've got business records, you're subject to ransomware, you want to have your business work, and you all of a sudden can't get into your billing, your customers can't access your website, that's a problem for firms in the bioeconomy as much as it is a problem for any other firm. But given the convergence with the information and computational technology, specifically in the bioeconomy, there's new concerns about cyber vulnerabilities. We have cyber physical systems that, in the end of the day, a firm is producing a product, whether it's a vaccine or an industrial chemical or a service. But in the lead up to that product, many of the inputs are not only raw materials, but data. And they're also, these manufacturing systems are controlled by automated systems. These are all potentially vulnerable to cyber intrusion. And in this case, a cyber intrusion can lead to a real world outcome in the output of that physical system. And we can actually have a dangerous physical outcome if you think you're making a vaccine and it's been adulterated, not because people have put a contaminant in, but because people have messed with the data that you've derived your vaccine from. And that's probably a bad example. There's lots of testing in the vaccine process. But if you have a data intensive process leading to a physical output and you corrupt the data, you have to concern yourself with how the output is. As I said, another way, cyber threats to key data sets, which are the input, the lifeblood of the bioeconomy. And then another aspect that the Academy report called attention to was vulnerabilities due to reliance on open source software. We often think open source is more secure because there are a lot of eyes looking at it. On the other hand, open source packages are sometimes not maintained to the degree that a proprietary software system would be. It may not be upgraded to the point that all the components of it are brought up to the right standard. And there's a fair amount of open source software involved in the bioeconomy. We called attention to some concerns about that. And then the final topic I want to spend a little bit of time on is this economic attack issue, which we have gotten a lot of attention. This would include the theft or misappropriation of trade secrets, certainly in the corporate world, where firms' lifeblood is their intellectual property and their ability to know how to do things better than their competitors. If that information is stolen, that puts those firms at a great disadvantage. A little harder to deal with is the academic sector. And here we also have seen a lot of discussion about the threat posed by foreign students or foreign scholars in universities. Here, I think a better way to frame this discussion is to really say that the things that we're worried about, the illicit transfer of knowledge and technology, is already covered by rules of academic conduct. And if you're illegitimately sharing information that is not public, that's a form of academic misconduct. That should never have been tolerated in the academic sector. It shouldn't be tolerated now. And if we have better ways of identifying this, then that's a problem that we need to be able to work on. We also have the issue that the US government has called a great deal of attention to in terms of undisclosed foreign affiliations. Often when a researcher receives a grant from the federal government, they need to disclose their affiliations with other institutions that might be posing a conflict of interest or might be posing the risk that work funded by the United States is actually going to be conducted elsewhere and to the benefit of other parties. Reminder that this is the research sector. The ultimate product of research is typically put in the public domain anyway. And so it makes concerns about illegitimate access to research in a different type of concern than from a corporation where maybe the lines are a little clearer cut as to what's public and what's not. So ultimately, we're putting information in the public sector. And as we had discussed in the first panel, and I'm going to foot stomp here, the openness of our academic and research enterprise has been critical to the degree to which it's prospered around the world. In recognizing that, one of the recommendations from the National Academy's report is that the US government should, the US government should continue to support policies that attract and retain scientists from around the world who can contribute to the US bioeconomy, recognizing that the open academic engagement has been strongly beneficial to the US scientific and technological enterprise. And here I added emphasis to the report, even as it inherently offers potential benefits to other countries as well. I'm sometimes intrigued by the term academic espionage. Sometimes being, and I'll agree there are legitimate issues here that we do have to pay attention to, but at some level, worrying that people are coming to US universities and returning with knowledge is a little like being concerned that they're going into stores and coming out with food. That is what our academic system produces. It produces people who are smarter and produce research, and we want to welcome everybody who can contribute to that. And in particular, we are highly dependent on foreign students and scholars, and we need to be very careful with putting on restrictions with the aim of dealing with illicit transfer, which has happened, which is a problem. But it's one of these areas where we need to make sure we're striking the appropriate balance. One thing I would like to also emphasize is that we will only let foreign students come to the United States in the first place if they can prove to a US consular officer that they will take what they learn here and go back home with it, presumably to compete against us. We will not let them come if they say their objective is to remain in the United States and contribute to the scientific and technological workforce, which, by the way, is critically dependent on foreign input. So we have to make sure that while we're trying to address legitimate concerns, which have been raised in the earlier panel and we can talk about further, that we don't do so in a way that destroys what Bill Norris in the morning session said was the key characteristics that have put our innovation system and our bioeconomy in the position it's in. So we don't want to destroy those aspects that are making this thing prosper. China has about 1/5 of the world's people. It therefore has about 1/5 of the world's geniuses. And we want to make sure that they want to come to the United States. We don't want them going to other places and bringing that technical expertise abroad, because this can be a cascading process. If the US starts to lose its reputation as the place where the smartest people and the hardest problems are solved, that starts to go somewhere else. No brilliant grad students going to want to go to a declining academic infrastructure. They're going to go where the action is. And so keeping our edge is critically important, not only to generating the research results we need today, but to attracting the workforce and the results we need for the future. That's a precious resource that we need to be very careful about protecting. So let me wrap up here and look forward to the discussion.
Great. So well done all. I think the most interesting thing for me is that in past presentations that I've been involved with, there was an equating of technology with instrumentation. And each one of your presentations clearly demonstrated that that's not the case. That's not the case. The questions always tend to arise about, what about CRISPR? What about nefarious use? What about, genetic engineering and, so on and so on. But the path that each of you has laid out is very much different as it applies to the more global bioeconomy. Does anyone want to pick up on any of these aspects, or?
I'll elaborate a little bit. I think technology doesn't equate with instrumentation, but there's a correlation, because part of what lets you have a world-class research enterprise is having the best equipment in order to do the research and apply that. So science and technology are self-reinforcing. New science leads to the creation of new technology, and then new technologies come back and let you do better science. So at that level of instrumentation technology, it's not the whole thing, but there clearly is a connection there.
Well, let me ask another quick question. When we're looking for funding for our students, there are the standard grants, graduate student grants, postdoc grants. We need to be better advocates for our own enterprise. And I wonder if, for instance, not on the NSF side, they tend to have this better sorted through than some of us, but on the NIH side, I wonder if they're in the meeting type grants, the RO3s, or that could be used to support students, and foundations and professional societies. I guess I'm asking, you've identified an important problem nationally. Where do we go from here for some relief?
Yeah, NSF has a couple of grants that could be used for iGEM teams, but it's they're pretty strict rules, I believe, and it's only for high school teams as well. And so, yeah, there are certainly ways that this could be expanded. It's, I don't want to leave the impression that biological scientists this is their only opportunity to get an experience in the lab, because there are plenty of laboratories that will take undergrads to work in the lab and get that sort of experiential learning. But it's bigger than that. It's different than that, to be part of a competition, to be part of a team. to be able to think through an entire project and sell it, and to be able to explain it clearly to others. So there are more pieces of the puzzle that could inspire these students to want to have a company someday, or to be a professor and have their own laboratory. And so I think it's important to make sure that we have lots of opportunities for our experiential learning.
Doug, how does the I-Corps funding mechanism impact the relationship between the private sector and the universities?
So I'm going to zoom out and answer the question a little bit more broadly than I-Corps. And I'd also just like to add something about the previous question, unrelated to iGEM and undergraduates, but related to our graduate students and postdocs in the US. And that is, we have a lot of programs. I shouldn't say a lot. We have a limited number of programs where graduate students can apply and get NSF graduate research fellowships, et cetera. But the vast majority of students and postdocs are funded on research grants, where the PI is evaluated primarily on the production of research and not the education of students or the training of postdocs. And so there is a misalignment of incentives in the academic environment that comes from the fact that we're focused on research, but academia is about education and training, in addition to research and other public service missions. And I think if we are really want to be creative about educating the next generation of scientists, we should be creative about and think through the funding mechanisms that we have in place that allow these students to participate in the academic environment, and what that means for their education and training. This is a little bit of a soapbox for me, so I'll get off of that one and get to your question. It's one that I've thought about for a long time and think is extremely important for the US. One of the things about NSF that over the last 5 years, especially as it relates to biology, that I've been extremely impressed with is their interactions and really push to have interactions between companies and academic institutions. And whether that's I-Corps, whether that's also the way they frame SBIR programs and STTR programs to fund small businesses, as well as a more recent program called the Convergence Accelerator, which I'm particularly excited about. That's a little bit more focused on taking basic research and seeing it through to potentially create small companies, create some economic advantage. That is really taking learnings from something that happens actually quite well in China. When I think about and compare the US to China and how we develop technologies and how companies come out of the development of technology, I look to the US and say, look at all of these papers that we publish that have the most transformational results. And then I look at China and say, well, they took those transformational results that are in the literature and turned them into companies faster than we did. And so the NSF Convergence Accelerator program, as well as some other programs that are coming online from the US government, might help accelerate some of that, but it's really going to take sort of a change in mindset for how we think about biological technologies, whether they come from computer science, whether they come from any field, but that are fundamentally biological technologies, and advance them into the future. Answered more than you asked, Glenn, but wanted to get a few things in.
No, excellent. Other comments along those lines? Okay, so some of the questions that have come in over time is the term digital biosecurity or cyber biosecurity are starting to appear. Does anyone want to take a chance at what that means?
I'll jump on that. That's, I think, an acknowledgement of the point I had discussed about the convergence of the information and computer sciences with biotechnology. And in trying to secure the bioeconomy and secure firms within the bioeconomy, one has to now acknowledge that there are digital mechanisms by which your security can be impaired. And these are, again, of two types: is the traditional cyber threats to any other business. But the more interesting one is the convergence of the information aspect with the biosecurity aspect. We've seen some pretty interesting papers. I think there's a bit of debate about how significant they are other than being a stunt, but there has been a demonstration that people, through the formation of particular sequences of DNA, have been put that in through a sequencer machine and have been able to induce failures in the software upstream of the DNA sequencing. I say that's a bit of a stunt because the failure was artificially engineered into the software reading the sequence. It's almost like if you say boo, I will crash, and they said boo, and it crashed. So not quite, but there was a bit of an artificiality in that. But nevertheless, the coupling of the physical and the information worlds, making a mal string of DNA, putting that in your synthesis program, excuse me, your sequencing program, and having that crash a system. We've had another paper I've just seen recently of ways to evade the screens which are put on the manufacturers that make synthetic DNA are typically looking at their orders and ensuring that they're not making something dangerous before they just blindly ship it out. And so they're screening their orders against various databases. And just like there's a measure countermeasure move in cybersecurity, there's measure countermeasure moves one can imagine in DNA. One can imagine coding DNA in such a way that you build in a CRISPR system, which then patches into the code that you didn't want to put in. There's games you can play, and not that these are necessarily all significant vectors, but they're all illustrations of the fact that you need both biological expertise and information expertise to look at the intersection of where vulnerabilities might occur. And that's sort of what's being tried. I think that's what's being captured by this new terminology.
Glenn, if I can jump in, I would like to, with the 84 people participating, advocate that we stop using the phrase cyber biosecurity. And the reason for that is, Jerry gave a bunch of really good examples. And when I think about those examples, I see them either as biosecurity issues or cybersecurity issues, or sometimes both. But just because they're both doesn't make them a new thing. And when I have conversations with companies and academic labs, what we usually end up devolving to is a conversation about how researchers need to really think deeply about cybersecurity for themselves. And a lot of the cybersecurity practices that are more resilient in other industries have not made their way into the biotech industry the way they really should. And it's because of, in my view, a lack of awareness across the industry and a lack of visibly seeing negative results that have come from the lack of cybersecurity. It doesn't mean they're not happening. It just means they haven't seen them. And so I think that we need to think, a little bit more about the two areas separately before we start worrying too much about sort of a new area that is sometimes interesting in some papers, but maybe isn't the core of the issue today.
Comments? Okay, so in just a bit here, we're going to entertain some external questions, but I'm going to put one more on the table just so that I don't get beaten down later. And it's the larger questions that come from the public sector on genetic engineering and the nefarious potential uses of, say, CRISPR technology. And so the instrumentation is available. So if you so I'm trying to give some people a sense of security, I think is what I'm doing here. So if you purchased all that equipment, you had it sitting in a lab somewhere here or somewhere else, the data, the knowledge, the specific snippet of a microorganism that you would like to replace to make it, a more intense pathogen or whatever. So that piece of information I view as the security link. I mean, there just aren't many people who know, what piece of the genome you'd need to modify in order to get to a nefarious endpoint. And even if you knew, the capability of doing that without, offsite modifications and whatever else is just not something that everybody can do buying things at the local drugstore. Any comments?
I'll start. I think you're sort of getting at the concerns about people using available genetic engineering tools or available lab equipment to making new pathogens or facilitating creating a dangerous biological organism. And there's a tendency to focus on the science and the high-tech aspects of that. But I think it's also important to keep in mind that the process of making and delivering a biological weapon includes a lot of downstream steps. Now, footnote, a contagious agent skips a lot of those downstream steps because it does the transmission by itself. But in terms of something like our new old and beloved anthrax for the community, you can make an agent, but having that disseminated effectively and getting it into the people that you're trying to attack involves a lot of engineering and a lot of skills that aren't necessarily made easier because you can do your biotech part better. There are things you still need to do. So one has to always, in looking at these vulnerabilities, look at the whole entire process. But on the other hand, let me raise something that may be not a reassurance, but more of a concern. I think there's the age-old question that everybody in the audience has been dealing with for decades, which is that if this is so easy, why hasn't it been done before? Well, one answer might be it's just not that familiar. The people who want to do damage on this kind of scale know a lot about explosives, they know a lot about guns, they don't necessarily know a lot about biotech. But as the bioeconomy grows and prospers, it's going to be a bigger and bigger part of just normal everyday life. More and more people are going to know bio stuff. It's not just going to be the people who studied biology in high school and college. It's going to be a large workforce. It's going to be much more familiar. And I think the answer to what terrorists want to pursue is they pursue what they know. If a terrorist comes knowing guns and bombs, that's what they're going to work on. If a terrorist knows biotech, then that's what they're going to use. And so I think one concern we do have as this industry grows, which is bringing the benefits that our technological optimists and the rest of us are looking forward to, it also comes with it bringing more awareness and more skills at this whole general set of activities. And to the extent that that general set of activities can lead to dangerous applications, that's just a concern I think we're going to have to understand is going to be there.
Okay, if there aren't any other,
I'll add one very quick comment.
okay,
To try to end this portion on techno-optimist.
yeah.
We appear to have, we as society appear to have developed a highly effective vaccine for a pandemic agent in a year, which is an incredible accomplishment from the biomedical science community. Because I'm always looking to the future, I say, when does that year become a month? Right? When is that possible? And if that's possible, what does that mean for the potential security concerns that you raise, right? Part of it is from the fact that there's a lot of damage that can be caused. There's the fear aspect. There's a lot of pieces. But if we can take away those elements, we can be quite powerful. So I'll leave it there.
Yeah, great optimistic point.
Can
Lauren.
I just add a little bit to that,
please.
since we're talking about COVID? As long as everything was in 4 walls of a laboratory, there's really no limit to how fast things can get. But I think that a lot of our time savings is taking some of that and turning it over to look at how we learn from the clinic. And there's so much opportunity there. I mean, why did 80,000 plus people get convalescent plasma and us have no idea if it works or not? Like, that's just ridiculous. And that's the same sort of case for, how many studies of hydroxychloroquine do we need to do to be able to, and the opportunity costs of that. There are so many places where we could get faster and get better therapies quicker if we are paying attention to the data.
Lauren, would you like us to take some questions?
We actually have not had any questions come in. I think we're being a little shy. So if you have any, please send them to me. And if not, Dr. Lane, if there's some other points y'all would like to touch on, you'll have time.
I can go jump on what Gigi just mentioned about the importance of learning from clinical experience. the British have done amazing things with COVID because they build their ability to do clinical trials into the National Health Service. When you go in and you present with COVID, along with all the other information that's presented with your clinical care, is sort of checkboxes, and it enrolls you in a trial. I mean, the informed consent is there and everything else, but the informatics is all seamless. We heard some discussion in the morning session that we sort of have a balkanized informatics section in many aspects here in the United States. We don't have that kind of unity and the ability to build in that kind of trial, but we do have some very large medical systems, and they are doing that. I should turn to Gigi at the University of Pittsburgh Medical Center, which you have had some experience with. Has the same sort of approach where you can build in clinical trials in the course of delivering care. And in that sense, you're not running dozens and dozens of 200-person trials. You have, as it's not an extra burden, extra hurdle to enroll people in a study. You do what you do to them. You have the opportunity to use the experimental drug as well, and then it's all built in. And to the extent that we can draw on that, the Veterans Administration is a huge medical system that ought to have the possibility of doing something like that. We can learn a lot more from the people who are already there and already presenting.
Anyone want to comment on the supply chain for distribution of vaccines as a technology? The companies seem to have been all over this.
Well, I'm not as worried about getting the vaccines to places in different parts of the country to where they could be used. I am more concerned about what happens once the plane lands and that path going the last mile or two to the clinic, and so that people can actually get a vaccine. So I remember in 2009 when we were thinking about when we were all worried about H1N1, and there was a vaccine that was being produced at that time in an off-schedule year. We spent a lot of time talking about that last mile, and we spent a lot of time thinking about prioritization groups and what's the best way to do it, and a lot of cases ended up kind of skipping the whole prioritization because it was just too technically challenging. And I'm glad that there is some sort of plan, but I haven't heard, it hasn't been aired, and the resources haven't been committed to the local level. So there's a lot of work to be done, and I think that's the thing to worry about, not the supply.
Dr. Lane, we had a question come in. What would the panelists recommend to the incoming administration and Congress?
I can turn to the National Academy's report. It did try and come up with some recommendations as to how to implement safeguarding the bioeconomy, both protecting it and promoting it. And a lot of them sound kind of bureaucratic, but it was a recognition that the bioeconomy is quite broad in its extent, and correspondingly, the government agencies that have jurisdiction or missions affecting those aspects of the bioeconomy are themselves a very broad set. There's economic agencies, there's scientific research agencies, there's national security agencies, there's international agencies. And so it made a recommendation there needs to be a broadly interagency effort looking at policies which are proposed to, first of all, there needs to be a broad interagency group formed. And one of its first orders of business, Ed, you will be happy to hear, is to develop a national strategy. That there should be a game plan that kind of guides where at least the federal government is going with its efforts, recognizing it's a national issue, not a federal issue. But this committee needs to be broadly interagency, and it needs to be well informed by experts from the various different sectors that are associated with the bioeconomy. And as an aspect of that, given the particular security challenges, there's always either an actual or an implied issue when the government is making security policy on the basis of information it cannot share, that's classified or restricted or proprietary, and the public, to the extent that that information is important to the policy, and my guess is it's usually less important than people think, but to the extent that there's a perception of that, then I think there needs to be a mechanism to be able to convince the people who are watching the process that if they can't participate in classified discussions, at least they know people who are in the room who might bring the kind of perspective they would bring. And so in the interactions of the government with academic and industry experts, there needs to be the ability to share non-public information, just so even if it isn't directly important to evaluating a policy, at least there's a perception that to the extent that this information is important, the scientific community can say, people who have my perspective were in the room and had the chance to discuss it as well. Obviously, we can't open those sorts of discussions up to the whole world, But I think there does need to be the need to provide some assurance that it's not just a bunch of security people that have no awareness of what the technological enterprise is doing, making policies that are affecting that technological enterprise.
Doug, do
Lauren.
you want to go first or shall I?
Yeah.
Okay, so among the many things that the U.S. government should be doing is touching on the workforce issues that I mentioned, is that it should be a lot easier for people who are trained here to stay here. That's, staple that green card to PhD or undergraduate degree. There should be better ways for the U.S. government to do contracting. So instead of to be able to take advantage of a more holistic cost savings, which would favor biotechnological approaches and distributed manufacturing than just than the actual price per widget. There should be more tracking of data for a biotech workforce, with something that we don't do currently. And we should have a new strategic plan for the U.S. government for how we are going to grow the bioeconomy. The one that we had was a few years old and didn't have a chance to really take off. There are ways that we can encourage biotechnology companies to stay here and instead of moving overseas as well. So there's a lot that people would like to see, and then of course there's just more funding for students and for retraining for people who are already in the workforce. And I know Doug has more to say about that.
Sure. So I have two specific things that I would recommend to the incoming administration, come from somewhat wildly different categories, I think. One is that biology and biotechnology needs to be thought of at senior levels of government, the same way we think about computing and computer science. Meaning, you can't go to a federal agency or department, you cannot talk to a senior leader who doesn't know something about computers, who doesn't know something about the fact that they sit in front of one, they use one, they have to interact with a computational infrastructure that is required for daily life. And I'm not saying biology is there, but I'm saying that we need to start thinking about when biology will be there and how we get there. Because if we do that, then we start to take a whole of government approach to both solving national problems that we have, thinking about the new workforce that we're going to need that comes from these enabled technologies, and develops an awareness across government that is more robust than just there's this bio person that is one of 20 in a room that has their 15 seconds and then they start talking about quantum information science again, for example. The second thing is I think we need to really think about infrastructure in this country. Infrastructure that allows biotechnology to go from the early investments, the hundreds of millions of dollars we've put into synthetic biology, R&D, and turn that into commercial products. Today, it is very challenging to go from modern synthetic biology to a commercial scale production of a chemical or material without leaving the US. And I'm not saying this because I want to take a protectionist approach. Being able to do it in the US doesn't necessarily equate to doing it in a protectionist way. We just can't do it at all. We have such limited infrastructure to be able to get there that we should really think about how can the federal government enable the creation of some of that infrastructure. And this goes back to public-private partnerships, partial federal investment, leveraging possible state and local investment, because this biotechnology doesn't have the same CapEx that a lot of other technologies have. So you can imagine doing these things in a distributed way, but it does, biotech isn't exactly an information science. At the end of the day, it comes down to physical material, and we need to figure out how we convert that knowledge and that expertise and that ability from early R&D and from information science to the physical material that is going to be the thing that ultimately enters and impacts the economy.
I'll jump in again here. There's been a fair amount of discussion both here in the previous section and in the chat about a national strategy. But one thing you need to do to have a national strategy is you have to have the information that informs where you are and where you're going. One thing we recognize with the National Academy study is this concept of a bioeconomy is relatively new, particularly the way that we've defined it. And the existing systems by which the government collects data on its industrial enterprise, the US economy, isn't quite matched to the way the bioeconomy is set up. And so the Academy report suggested that the statistical collection, both in terms of industrial codes and in terms of product codes, ought to be reevaluated and tweaked so that we actually know what the bioeconomy is. We now have sectors in, say, the bioproduction of chemicals, where it may be difficult to figure out how much of a chemical is produced from petroleum through chemical processes and how much of it is produced through bioprocesses. Well, the bio part may be a rapidly increasing part, the chemical part may be a rapidly shrinking part. The sector may look static, but there's actually a lot going on that you don't know because you don't have that level of visibility. And so there were some recommendations about just increasing our statistical awareness of what actually the bioeconomy is and what it's doing. And that would then inform a strategy development process.
Very good. So I'm going to try to end on a positive note here. This is maybe addressed to some of the comments that Gigi made. So we have a very large, and I also get a plug in for A&M in this comment, a very large vaccine production facility here on campus. Thank you, DARPA. And when it was built, it has a very large training component to it, which is isolated from the vaccine production and the vaccine research arm. So we train a large number of students into, what is really cutting edge biotechnology. And we also recently built a BL3 Ag facility, which within that facility, there's a very large training facility as well. So we're trying to at least offer the opportunity for people to have what may be called jobs of the future, if you will, through adding training facilities to some of the laboratory assets. Okay, Lauren.
We are going to go to Professor Natsios now for a short introduction of Dr. Blackburn, who's going to give closing remarks.
Okay, can you hear me?
Yes.
Okay, so thank you all for being with us. We have another session, of course, from 8:15 to 1 tomorrow, the second day and final day, where we will focus more on the legal aspects of the bioeconomy. But to make some closing remarks, we have Dr. Christy Blackburn. She is the Deputy Director of the Pandemic Policy Program at the Scowcroft Institute. Dr. Parker is the director. He will be with us tomorrow to speak. And she is the one actually who writes the papers that come out of the annual summits that are on the CIDIP site, the Scowcroft Infectious Disease Information Platform, CIDIP, which is hosted by the University Library. And it has a lot of our research. It has blogs by scholars and experts from around the world. But Dr. Blackburn manages that, but she also manages the process for the policy paper. So Christy, why don't you make some closing comments today?
Perfect. Thank you, Professor Natsios. So I just will make I'll just take a few minutes to make some quick closing comments, as Professor Natsios said, and to thank you all for joining us on day one of the Scowcroft Institute Annual Pandemic Policy Summit. We started off today learning about our dependence on China for essential generic drugs. While both enlightening and concerning, it's also promising to hear about the efforts that have begun to address some of these gaps in pharmaceutical manufacturing. Panel one took us through a thoughtful discussion of what the bioeconomy is and how we can conceptualize bioeconomic challenges in the future, whether that's pharmaceutical manufacturing, data ownership, or elements of economic statecraft. The panel laid out serious national security, scientific, and healthcare challenges that we face in our bioeconomy space race, as it was termed. Panel 2, which just wrapped up, gave us a little bit of a different look at the US bioeconomy and discussing some of the internal challenges that we face, such as student training and support, and some of those infrastructure challenges for our own bioeconomic endeavors. These two panels have provided a broad frame that we can use to understand the bioeconomy as we move forward into our discussions tomorrow. So tomorrow we have some more experts that will continue to discuss the bioeconomy. Our first panel will focus on intellectual property and legal challenges. And then the second panel will focus specifically on COVID-19. And as a reminder, we start again tomorrow at 8:15 a.m. Central Time. So those of you who aren't Central Time, convert that. And before we go, I just want to make a quick plug for a new book that we have coming out this month titled Preparing for Pandemics in the Modern World. And this is a book that we started working on after the annual summit 2 years ago, has chapters authored by some experts, including David Morans and Jeffrey Tenenberger, Jonathan Quick, John Hellerstadt, Lisa Kunin, Rebecca Fish, and Richard Crespin. It also has